virtually at a later time. So excited for you to hear all this wonderful information that we have for you today. My name is Belinda Alvarado, and I'm the Prevention Coordinator at the National Council on Alcoholism and Drug Dependence for their Community Prevention Program. Our program focuses on youth prevention, youth engagement, and leadership development, as well as providing education to the community on marijuana, vaping, alcohol, and prescription drugs. And so we do work in Pomona, Covina, and surrounding areas. So good morning. I hope you all have your coffee ready. Oh, you can't see it, but I have it. And you guys are excited to hear all of this wonderful information that we have.
Yes, so I would actually like to thank Gabriel Calanco, who is a licensed clinical social worker with over 15 years of experience in community mental health. He's actually been the manager of wellness and recovery at Tri-City for the last 10 years, and he was instrumental in the planning, development, and program implementation of the center. The center serves as a hub for activities and offers an array of services, including support groups for all ages, employment services, and spearheads various campaigns in the community. One such campaign is the Bye Bye Butts anti-smoking campaign, which is held every year on the third Thursday of November. And we are grateful that we have the opportunity to collaborate with Tri-City Mental Health, with the American Lung Association today, with physicians from the Pomona Valley Hospital, and we are grateful that we also have a number of other speakers from Cedars-Sinai and also from Day One. So we are really excited and just glad that everyone can be here. Belinda, are you ready to introduce our first speaker?
Yes, I am. So our first speaker this morning, her name is Sonia Reina, a community navigator for Measure H, and that's homeless population. Sonia works for Tri-City Mental Health Services. In January, she'll have been there for 9 years. So thank you so much for all of your time and dedication. Her goal is to be working and dedicating more time to the hurting and lost in the world. And her aspiration is to go on mission trips to the underprivileged in the world. So we're so thankful and glad you are here with us today. And we're so excited to, just hear your story. So the floor is all yours, Sonia.
Okay. I was tell you, thank you for having me. Okay. When I was a child, I was raised by my mom's mother, and she was a Lucky Strike woman. So I'm not sure if anybody knows about Lucky Strike cigarettes. They're the ones like Camels with non-filter. And when she would be combing my hair before I went to Catholic school, she'll be having one side of her lip and combing my hair, and then she'll blow it in my face. But then in the 70s, early 70s, there was no secondhand smoke. So I grew up with not knowing so much about the effects of smoking cigarettes, the cancerous toxins that it has. And as I became a teenager, I got a job working at the Wiener Schnitzel here on Holt. So I would go from Ganesha High School to work. And I started picking up the habit of smoking cloves. I'm not sure if anybody's familiar with the old cloves. And I would smoke it, and it had like a little cinnamon, but like a little bit of a Turkish taste. And then I started getting addicted to it. And it's so weird because I was living by then with my dad's mother, and she would let me smoke the cigarettes in her car, and I was in high school. And we just didn't think nothing of the effects of the cigarettes, you know what I mean, then. And then later on, I quit smoking, and then I started smoking Super Cools. I guess I always wanted to have like a flavor, besides just the tobacco. That's what got me addicted to it. Not so much the nicotine, more like the flavor. And then eventually, as I got sober and clean, I started learning about the cancer effects, and I started seeing in commercials in the 90s about men that will chew the tobacco and their guns would get like they would get not only like cancer, like in their gums and their tongue, and then people were coming out with trachs, and there was like, because of the effects of smoking cigarettes. So then that's when I knew that was the best thing for me, was to have quit smoking cigarettes, you know. So well, you know, it's been a journey. Probably haven't had a cigarette maybe now since 2000, so it's been like 20 years. Yeah, yeah. So thank you.
Thank you so much. Go ahead, Shay.
We both thank you, and we all thank you for being here to share such a sincere story and your experience with us. Thank you. And I'm sorry, Belinda, I'm stepping back out.
Okay. Yeah, thank you so much. And I think you touched on a very important point that I think a lot of our young folks are going through right now with the flavors. And so you mentioned, the flavors is what, drawn you to them and things like that. And so I just appreciate you for sharing your story, because I know a lot of the youth that we work with, flavors is something that attracts them to the now vaping products. And so, you said, back then, like, we weren't sure what the health effects are. So I think your story will definitely reach a lot of our young people today. So just thank you so much for sharing. We really appreciate it. So big round of applause for Sonia. Our next speaker that we have is Mary Hendrickson. So we would love to thank Mary Hendrickson for coming to share her life's experiences with us today. Mary works at Tri-City Mental Health as a clinical wellness advocate. She's looking to continue her education to become a certified drug and alcohol counselor. She has 10 years of experience working in some capacity with Tri-City. So thank you, Mary, for all of your experience and all of your time and dedication to the work that you do. And super awesome that you're going to continue your education. I'm sure you're going to be an awesome drug and alcohol counselor. So I'm going to hand it away to you, Mary.
Okay, so I'm going to make it because my voice is going. I'm in recovery. So I'm a recovering alcoholic heroin addict. I grew up as a kid trying smoking and drinking because there was trauma and abuse at the age of 3. So grew up that way, figuring that the cigarette would kind of make me forget. I used to smoke 5 packs a day of cigarettes. So I'd be spending about $300 something. And there was a little old lady over here by the Wellness Center, because I worked here for 7 years. And I'm a former client of Tri-City. So the lady would tell me, "Why are you smoking? You're gonna die." And I would, like, in my head, I'd say, "Well, why are you coming up to me? Leave me alone." But she kept pushing and pushing. And then when Gabriel had the first event for Bye Bye Butts, I thought about, well, what it'd be like to not smoke, right? So I called Bye Bye Butts. They gave me 2 life coaches to help me, to support me. And they would call me on the weekends. And they sent me 14 free patches, so I would wear them. And then I tried smoking, and I went from 5, 4, 3, 2, 1, and I stopped at Thanksgiving. So coming up, I'll be having 9 years not smoking. So yeah, so I did celery, sweet peas, steamed vegetables, peppermints. The only coping skill that stuck with me is spearmint gum. So that helped stress too. So, but it was hard because psychologically it started affecting me. I am diagnosed. So, but it's about 6 months, then I was okay managing. So I'm waiting for my 9 years on Thanksgiving, so I can eat some more food. I got to work on the weight, so that's okay. But I worked for Gabriel 7 years, and now I'm a clinical wellness advocate at 2008, the medical clinic. I am a clinical advocate. I have 10 years with the agency. I've been clean and sober, coming up 15 years. So it's step by step every day. I can't stand the smell of smoke now. It bothers me. I can taste my food. I can smell it. I mean, It's good. And smoking would intensify my anxiety. And I'm like, oh, that's what it is. You know, I'm like, oh my God, I can't breathe. So now I have asthma and I became diabetic. So I'm turning everything around. I'm following up for my health, my self-care, which is priority. Um, and I'm glad I'm not smoking. Makes me feel better. I can go to down the street, not walk halfway, you know, and stop and huff and puff. But that's my story. It's anybody can do it. It's just a process, you know, to quit smoking. So my spearmint gum, that's my coping skill. So, and it relieves my stress. So, and my anxiety now, I haven't managed. So that's my story. Thank you for having me.
Thank you so, so much for sharing your story. Super powerful, and I think very inspiring to a lot of the, you know, folks that are listening here with everything that you've been through. So I just appreciate it so much. I do have a question for either Sonia or Mary, if you want to answer. So today is, you know, bye butts. Hopefully, a day where someone will decide to make that decision and stop smoking. So what is some advice that you would give someone that is maybe thinking about it, or maybe they're like not sure if they're going to stop or they're going to continue smoking? So if you could give someone one piece of advice, what would that be?
They can stop smoking or try to maybe a couple hours, maybe an hour, just to try, you know, drink plenty of water, you know, it flushes all that poison out. But they don't have to really stop right away, you know, cut themselves down a little bit, you know, they'll feel much better, you know. So that's what I would tell them, you know, just a little bit at a time.
Baby steps.
Me, I think it was more like I had said, the old commercials of the effects of what the cancerous toxins was doing to the people, health wise. That kind of scared me because I have 5 children, and today I have 15 grandchildren, and I think that the health wise, for me to stay here long enough to be able to spend more time with them here on Earth. Um, because when that Marlboro Man got cancer, I was really devastated. You know, remember the handsome Marlboro Man? Yes. So it's like health wise, like Mary said, you know, we have to look at like the pros and the cons. You know, either you can look sophisticated and all that, but that went out a long time ago. It's not sophisticated anymore, and the negative of it is that mine is like the health. So if a person's really serious about their health, I mean, you could go to the gym and all that, but then come out and smoke a cigarette. It doesn't, you know, balance, you know? Yeah. Okay.
Thank you so much. I really appreciate it. And I know today for sure the words that you are sharing, they're going to impact someone. So powerful. So I just want to thank you all. If you have any last words to add. Mary, I think you're muted.
You're muted.
Oh, I gotta go to work.
She got to work.
I gotta go outreach. What's up, buddy?
Perfect. Yeah, no, continue what you're doing, continue making a difference. I know both of you are, you know, definitely making differences in our community. So big round of applause to both of you. Thank you so much.
Thank you.
All right.
Thank you. Continue to be impactful. Again, we appreciate all that you, Sonia and Mary, are both doing. You're wonderful people, and we are highly encouraged and again inspired
Thank you.
by what you've shared today. And we know, as Belinda said, that many more will be as well. Thank you.
Thank you.
Perfect. So we're going to continue on. We have all day activities today. And so our next speakers, we have Dr. Hathaway and Dr. Cruz. So I will introduce them. And while I'm introducing, you are free to put up the PowerPoint, your guys' slides that you have. Let me make sure you are able to do that. Give me just a few seconds. Shay, you'll probably have to do it on your end.
Okay.
Yeah, I think we can share the screen. We might be able to do it.
Yes. So while Shay is working on the co-host stuff, I'll go ahead and do the introductions. So like I said, we have Dr. Hathaway and Dr. Cruz here with us. So Dr. Millie Hathaway was born and raised in San Francisco and went to medical school here in the Inland Empire. She has been passionate about partnering with her patients and working with vulnerable groups and addressing health disparities in her community. Dr. Hathaway is grateful to be a part of Pomona Valley's Hospital Medical Center's family medicine program, and she is surrounded by supportive faculty and residents and the opportunity to serve a diverse patient population. Her interests include community medicine, urgent care, and outpatient clinics. So thank you so much for being here with us today. We really appreciate it. And with her, we have Dr. Alex Cruz. So he was born in Mexico, but grew up in East Los Angeles. He pursued medicine because he wanted to help underserved communities, having come from one. He is part of the Pomona Valley Hospital Medical Center Family Medicine Residency Program and is looking to further develop his medical education and use his bilingual and bicultural skills. Dr. Cruz sees himself working in a setting that has community outreach for new immigrants or underserved communities, outpatient clinics, and inpatient medicine. So thank you so much for being here today. We're so excited to hear all of the information that you both have to present to us. So the floor is all yours.
Okay, so like today we're talking about tobacco cessation, a lot of the different triggers, but also support that's available. So kind of starting off just with our objectives. We have our identifying triggers, which a lot of people would kind of know why they're smoking. A lot of the reasons and benefits of why it's best to quit. Also kind of assess the readiness. I know today for some of you guys, it is your smoking stop date or the day that you are initiating to stop smoking. So congratulations on just being on top of that. Then the other aspects also is just the benefits that smoking does for mental health and also the risk that it does whenever you are smoking. Just knowing a lot of the withdrawal symptoms and the different methods there are to kind of quit smoking. So like a lot of here, I'm gonna ask from like the group, like to kind of know what are your triggers when you are smoking. So anyone can kind of like say something out there in Zoom. Well,
Smoking with my morning coffee.
yeah, a lot of it like with your coffee in the morning, or you're out at drinks, you have your you're having your drink and then you want to have smoke. Also, a lot of them are like after a meal, just seeing someone else smoking there with you, you start smoking. At work, you feel stressed, so you will take your work break, or after work, watching TV, and also after sex is a common ones that are people usually doing. But there's also some emotional ones whenever you are feeling sad, you're feeling angry, anxious, guilty, or even tired, you will kind of go out and smoke just to kind of get that little burst of energy. So a lot of it is like whenever you are ready, it's a very different cycle, and you have to kind of see what are changes occurring out and with your life for you to stop smoking, or the reasons why you are smoking. But the realistic thing is, as soon as you start doing one cigarette less a day, you're going towards quitting. The best things that kind of help out a lot is to make a diary of how much actually you're smoking every day and what triggered you to smoke more that day, or what kind of helped on a certain particular day to smoke less. In 2015, it was 68% of smokers that wanted to quit. That kind of started assessing the readiness, but in 2018, it dropped to only 55%. So there has been some decline, and a lot of it has to do with different marketing. So here's the kind of question, same thing I'm trying to ask anyone out there in Zoom to kind of see. There's 3 different questions, and depending on like if you're asking like, how do you feel about quitting smoking? If you're answering, I like to smoke and I'm not planning to quit, there'll be a different response. If you liked a lot of things about smoking, but you're looking to quit, or if you're ready to quit. So depending on where you feel you're at, you could kind of go into the different answers. So if you are saying that you like to smoke but are not planning to quit, kind of think about like, why are other people quitting? How is your health currently, and how could it be improved once you quit smoking? I know with smoking, there's a lot of like the smoker's cough, which you're constantly coughing, you're out of breath. It could also cause elevated blood pressure. So it's like, how are those impacted on your day-to-day life? And also just family history of cancers. Smoking kind of does increase the risk. For the second person that says, I like a lot of things about smoking, but I'm looking to quit, or you're willing to quit, then kind of ask yourself, how will it be better after you quit smoking? And for the last question, as I'm ready to quit smoking now, you could kind of ask yourself then, making a plan and timeline of quitting smoking. So it's just kind of creating a set time and be more realistic. There will be relapse just because there's some stressors. No one's 100%. So by you having a pack of cigarettes and you're doing less a day, but then one day something happens, it'll be assessing and kind of getting that support. So here, kind of little like timeline of what everyone thinks. It's like you're pre-contemplating like, okay, I know I smoke a lot, but what will be the benefit? When you're contemplating, it's like, okay, I want to stop smoking already, but what is there to do? The planning is where you kind of go out with either a support group or your physician to kind of help you out and see what you could do to stop smoking. Action is actually just decreasing your amount of cigarettes, and maintenance. It's always the best, like to kind of have a good lap of not smoking. In there, you kind of see there's a relapse of everything. At any step, you could go back, and then you just learning how to get back up and kind of having longer periods of smoke-free time.
So after just thinking about how ready you are, contemplating on what your potential plan might be or what a potential timeline looks reasonable for you, a really important step is picking your quit date. And it requires giving yourself some time and being patient with what's reasonable and realistic for you. Some people say that 1 week is a good timeline to prepare. It really is up to you, whatever you feel comfortable with. But just the act of picking a quit date already is a big deal, and it means a lot. So in terms of picking a quit date, it's recommended that it should be around a time where you feel like you would be the least stressed. So for example, people have said that they have chosen a quit date if they're not at work, where they have a lot of triggers, or not around a lot of social events where they would feel triggered to smoke. So whatever it means to you to feel like you wouldn't be as exposed to your triggers, picking a quit date around those has been most helpful. And then I know, like we had mentioned, Dr. Cruz had mentioned earlier that today might be a quit date for a lot of our participants on Zoom right now, or it could be a date where you had previously set one before and then there was some relapses, and today you are renewing that commitment. So I do congratulate anybody who's on Zoom right now and choosing today as their date. So a next step would be just finding your own encouragement and support, and whatever that looks like. For example, it could be your family and friends, getting help from your primary care doctor, or just looking for more support through counseling programs or other cessation programs. So with your family and friends, don't be afraid to talk to them about how you've been feeling. And then just asking them honestly for their support. So for example, asking them to just be open to listening, helping you in your plans in terms of minimizing triggers, for example, asking them to go for a walk with you or whatever kind of physical activity you enjoy. If you're in some kind of social or group setting, I know with COVID that might look different, but ask one of your friends to remain as one of the non-smokers, so you have just somebody there that you could hang on to as someone who's minimizing those triggers. And then if you're in the presence or if you're surrounded by people who are still smoking, just asking for their support in terms of having them hold off on smoking in your presence or hold off on talking about smoking while they're in your presence. And then seeking support from your primary care doctor. This has been particularly helpful if you're having some issues quitting and you're on your own and it hasn't been successful. Your doctor has a lot of other resources for you in terms of replacement therapy or another nicotine replacement therapy that can help with withdrawal symptoms. And then with counseling, it has been shown that the more counseling that you get, the more successful you'll be. So your local health department or your primary care doctor actually can recommend some programs to you. There's also telephone lines like 1-800-QUIT-NOW. These are free counseling over the phone. And then as well as text. So if you were to send a text to smoke free TXT, smoke free text, they can provide quick tips on cessation as well. And then the next important step is to just incorporate healthy changes. And that might look different to one person from the next. So managing stress. Quitting can provoke a lot of stress, and what that looks like could be very different from one person to the next. Changing up your routine. So you have a set routine now, and then when you quit smoking, that routine looks very different. So for example, if you know that there's a certain way to work, or there's a certain work break or activity after when you get home that provokes your sensation or trigger for smoking, then change up your routine, going, or like for example, going for a walk or calling a friend. Staying physically active has been very helpful. And when we say physically active, it doesn't have to be a very strenuous activity. It doesn't have to be a very intense new regimen. It could be something that you enjoy. It could be something very relaxing, like taking a walk. Walking has been shown to be very effective, not only for your physical health, but then also mental health as well. And then incorporating relaxation techniques. This has been, I heard something a little bit more challenging, because whenever you have the sensation of wanting to smoke, it's very difficult to try to sit with the sensation and sit with yourself. But the recommendation that we heard is very helpful is to just take a deep breath and then just remain calm, focus on your breath, and the sensation hopefully will pass that way. And whatever relaxation technique, whether that's just sitting down and focusing on your breath, or going for a walk, or for example, writing in a journal, just figuring out and being open to what might work for you. And then rewarding yourself. That's something also that is very important. Is this whole entire process is very difficult. And it's nice to kind of show yourself that you're doing what's best for you, and that's something that you should definitely make yourself feel good about. So rewarding yourself after however many days or weeks of working so hard at this process, and either going out to dinner, getting takeout now with COVID, treating yourself to a meal, or buying yourself something that you felt like you wanted for a long time. Whatever that looks like for you, rewarding yourself is very important. So smoking and our mental health. There's a connection here, and smoking is more common among people with mental health conditions than those in the general population. So more than 1 in 4, about 28% of adults with some type of mental health condition smoke cigarettes. Just some statistics. And approximately 25% of adults in the US have some form of mental illness or substance use disorder. And we ask ourselves why the close connection or why that is. Um, so our question is, so what does nicotine actually do? So this is a really cool graphic, I thought, that shows what happens when we smoke. So the first step, nicotine in the cigarette is delivered when you smoke, and then it's a hormone or essentially a compound that travels to the brain. And what it does is it affects the parts of our brain that release another compound called dopamine. And dopamine is essentially a hormone or a compound in our brains that are more related to our happiness pathways. So when dopamine is released, it leads to feelings of feeling calm, feeling very pleasant, and then it activates the reward feeling in our brains. But over time, these dopamine levels start to decline. And this is where we start to feel not so great. And this is when those withdrawal symptoms of stress and anxiety start to surface. So when these feelings creep up, these are triggers for wanting another cigarette. So essentially, it's just this very hard cycle to break, mentally and physically.
So here are a lot of like the common symptoms of nicotine withdrawal. The first one that kind of happens is just you start getting a craving of it because the brain got used to just having this hormone or chemical in our brain. It'll send a signal saying like you want more. So after a while, if you don't get it, it'll start getting a little bit of anxiety and restlessness. Afterwards, you can get a little bit of irritability or start getting depressed. What happens with a lot of the times is you get a lot of difficulty to concentrate. You kind of will start doing different things to kind of fill that craving. Either you start eating more or you start doing different things that might not be beneficial. So a lot of what happens is with the medications that help will control that as well, or help with a lot of the symptoms of the anxiety, the sleep problems. And a lot of the times when people think of quitting, like how we said that there's a timeline, what everyone thinks is just a straightforward path from A to B. But what happens in reality is kind of like the picture below. There's a lot of ups and downs. You will get relapse. You will kind of see that you are smoking more one day, but then you'll go up and you'll be smoking less at different time. And this has to do with a lot of the withdrawal symptoms where you feel you are prepared, but you feel alone. And everyone experiences this. The thing is, with slipping or any relapse, the stress, you have to kind of know that everyone's going to go through this. So everyone you should have a support group, or you have your network. They'll know when you are feeling a little bit down or you feel like you have been smoking more, that they can help out. But the best thing is always just kind of like to stop smoking again. Just kind of, you did it once and you'll see the path, and it's just kind of prolonging the time frame. So it's not actually just a full timeline. It's a very spiral thing where you're going to contemplate, you're going to plan, you're going to create, you're going to be smoke free, but then you're going to relapse. And this is where you go back into the spiral and you're going to contemplate again or pre-contemplate that you already were there. And now all it is just to kind of reiterate, you're going back to quitting. For some people out today, it could be that they've already attempted to quit. They were relapsed, but now it's like you're back here again. You're going to be back in the spiral and just kind of maintaining this timeline of smoke-free longer. So now, with given the time that we're at, like COVID has impactly affected what we do every day. Now we have to wear masks. So that could be one thing that's been helping with smoking cessation, because you're reducing having to go out, having to take off your mask to smoke. But also the benefits of it is COVID leads to worsening shortness of breath, which a smoker already has. It creates more lung inflammation, making it a lot more severe for smokers. And what has been noticed is that in 2019, there was only 23.7% of smoking cessation. And so far in 2020, that has increased to 31.1%. So that's a 9% increase, just because there's been a lot more socially distancing. There's a lot more um, pressure from other people when you were smoke, one of your triggers. You're out at bars, bars are closed down, so you're smoking less at that time. You're working from home, so there might be less of a stress from workplace to smoke. So those are things to kind of think about and see how that has benefited someone. But also learning about the withdrawals because you're at home, you might be a little bit more anxious. So it's kind of like how Dr. Hathaway was mentioning, like doing different things to kind of keep your mind. So with the whole thing of how everyone was baking for the past like couple months when COVID started, like now you could do different things. You're at home, you could start working out, you could do little changes that you could kind of start seeing that you don't require a cigarette. There's also a website, smokefree.gov, that has different tabs on how where you're at. If you want to quit, if you've already quit, if you kind of quit and you're relapsed. And there are different tips there, different programs that you can kind of reach out to. They have different apps to kind of keep you motivated or kind of track your progress. And then now we kind of go on to like the different tools for quitting, how we had mentioned the different phone numbers there are, the 1-800-QUIT-NOW or the smoke-free text. These are a lot of different modalities you could use. There's a nicotine patch, the nicotine gum, which a lot of the times those are over the counter, someone could go, but sometimes those are difficult to obtain as well. So by having going to your doctor, you're able to get those kind of prescribed and even get at a lower price. There's different resources out, different organizations that could help with that. The one that has been always proven best is Chantix, which is known as Vareniclo. It's a medication. It helps with a lot of the nicotine withdrawal symptoms and will help you kind of like focus on not smoking. But all of these are prescribed, so you kind of have to be ready. You have to want that change as well as just accept that the goal is to stop smoking.
Okay. So Dr. Cruz had mentioned that there are a range of different types of therapies that can help you quit. And most of these are well tolerated by the general population, and they can be either over the counter or prescription. So we thought it would be helpful to just go over them to talk about what their common side effects are and how effective that they may be. So in general, these medications or medicines work by reducing your craving for nicotine and then essentially helping with decreasing withdrawal symptoms. And you can start taking these as you think about quitting smoking, or if you started thinking about your quit date. So essentially, you don't have to start taking these after you feel like you've quit. You can start taking them in parallel, even if you're trying to just decrease the amount of cigarettes you're smoking. Because essentially how they work is to just reduce your craving and need for the cigarette. So the first one here is the nicotine gum, and this is over the counter. And then just some common side effects are some mouth irritation, some sore jaw, hiccups, and stomach discomfort. We have the nicotine inhaler.
So with the inhaler, it's kind of the same thing as if you're smoking. It mimics the sensation of you just having something in your hand. But the common side effects is kind of like, there might be low for certain people, but there are common, is just you kind of are irritated in your mouth and throat because you're still inhaling smoke. There is a mild cough and as well as some stomach discomfort. You could do the nicotine lozenge, which as well is you're kind of just doing a lot of different things to substitute it, but you have the same common effect, which is irritation of the mouth and throat. You have a sore throat because you're irritating that And you kind of have the stomach discomfort, which just because it's a chemical going into your stomach. You have the nicotine nasal spray. That one now is a prescription, so you kind of have to see your physician. But it's just kind of like with any nasal spray, you're going to be spraying a chemical into your nose, so you'll have just a kind of nose irritation, have runny nose, and it'll go down to your throat. Then there's a patch, which different percentages of the patch, some of them will be over the counter, which you could apply on as while you're smoking, and you'll kind of notice you start decreasing your cigarette intake. But also, if you start increasing the milligrams of it, you need a prescription. But the only side effect of it that mostly is because you have to put it on daily or weekly, you will kind of get a rash around the area you place it on. Depending on the time you take it, if you take it at night, you'll have trouble sleeping because it'll kind of wake you up, because that's how nicotine will do it. So it's a lot of like finding out what works for you. Then we go on to the prescription medications. Those are pills that are intended to be daily. You have the bupropion, which is basically works on the same chemical that nicotine does, but it's now more concentrated. It will cause a lot of side effects of dry mouth, trouble sleeping. There are some risks, very low, depending on the person, but there's seizure. If the person has a seizure disorder already or an eating disorder, it just makes it higher for them to get a seizure. And then the other one, Vareniclo, which has been kind of like the newer one that's coming out with a little bit less side effects, is just the nausea, trouble sleeping, and if you kind of have any kind of trouble with any mental illness, it'll best to always talk to someone, just because it could increase them. Same thing with any of the other medications. So now with this one, it's just kind of like the different milestones, how we say, like it's all a spiral, but it's always best to kind of go day by day. Like you've already accepted you're going to quit and you started smoking one less cigarette a day. That's an accomplishment. But as you go, here's kind of a little timeline of what happens to your body as you stop smoking. With your first day of just decreasing your cigarette intake, you're going to decrease your risk of a heart attack, because it affects the blood vessels differently. 48 hours, you kind of start regaining a lot of your taste and smell sensation, which is kind of numbed down because of the nicotine. After 2 weeks, you start breathing a little bit better. You notice you're not coughing. You might be coughing more, but you're not short of breath. After 6 weeks, you kind of are decreasing all of this withdrawal symptoms that we had mentioned earlier, and you start feeling a little bit better about yourself. After 1 year, the rate of lung cancer or any other comorbidities like COPD, which is just kind of retained air in your lungs, starts to decrease.
So in general, to sum everything up, quitting is a very difficult process. It requires a lot of time, energy, dedication on our parts, but then also it requires a lot of support from family and friends, loved ones, from your primary care doctor, from community, local resources, cessation programs. So I think this is a really great quote that sums up just the fact that quitting smoking is rather a marathon than a sprint. It's not a one-time attempt, but a longer effort. And like we mentioned throughout our presentation, the process isn't really linear. It's not cyclic. It could be spiral. It's really individualized, dependent on the person's own process. But it can be done with time, energy, and dedication. So this is the end of our presentation here, and we just wanted to congratulate anybody who was there on Zoom for joining us and starting their process in terms of quitting, at whatever stage you're at. So we really are thankful to be here, and we appreciate all of your time.
Thank you so much, Dr. Cruz, Dr. Hathaway, your presence has been greatly appreciated. You have shared a wealth of information, and we know that it will be beneficial to those who are able to view this. And we just want to say thank you for your time. Thank you so much, Dr. Blocker. We know that you're present. We truly appreciate all of the information, again, that you have disseminated and shared with our public and our community. It's so important.
Thank you very much.
And next, we will have a presentation from Tri-City Mental Health. And this presentation will be, let's see, Belinda, are you?
Yeah.
I'm so sorry.
It's totally okay. Yes, so we will have a presentation by Tri-City, and today we have, I believe both are present here, but we have Ralph Lopez and Catherine Carney. So I will go ahead and introduce them. Thank you so much for being here today. Ralph Lopez is a certified substance abuse counselor who has been working the field of substance use for 10 years. Ralph's work experience includes working with Housing First Model, with ending homelessness with co-occurring clients. In Ralph's work, it is important to him that his clients understand that their identity is not their diagnosis, and that they are a person that struggles with the diagnosis. A quote that Ralph lives by is, "Get them to belong before we help them change their behavior." So I really love that. Thank you so much for being here. And I appreciate, that thing that you said, their identity is not their diagnosis. And I think that is super powerful and super strong as well. And so thank you. Do we have Catherine with us as well today?
Yeah, you know what? She's struggling with logging in. I guess it's telling her that she needs, I forgot what they said she needs, but she's having trouble logging in.
Okay.
Let's see.
So I will go ahead and introduce her, and hopefully she can hop on. And then Ralph, if you want to, we can wait a few minutes for her to probably hop on. But Catherine, she is also a certified substance abuse counselor who has been working in the field of substance use for 8 years in various settings and with various populations, including acute psychiatric hospital, detox residential, intensive outpatient day treatment, and prenatal program for women and children. Catherine struggled herself with substance use for 19 years and has not used in 9 years. So that's super awesome to hear. Catherine's passion is helping people see, no matter how difficult or dark our journey has been, there is always hope. So I love that. Hopefully we can get Catherine on. Ralph, if she tells you what she needs, please let us know and we can try to send that to her.
We can go ahead and just get started. I'm on the phone with her right now. Her computer is asking her to download Zoom. So we're having some technical difficulties with her. If anything, I could just read off of her slides and do pieces of her presentation. So Ralph, I go for it.
Thank you so much.
So my topic is nicotine addiction. So cigarette smoking remains a leading cause for preventable disease and premature deaths in the United States and other countries. On average, 435 people in the United States die prematurely from smoking-related disease each year. Overall, smoking causes 1 in 5 deaths. The chance that a lifelong smoker will die prematurely from a complication of smoking is approximately 50%. Tobacco use is a major cause of death from cancer, cardiovascular disease, and pulmonary disease. Cigarette smoking is also a risk factor for respiratory tract and other infections, osteoporosis, reproductive disorders, adverse postoperative events, and delayed wound healing, duodenal and gastric ulcers, and diabetes. Smoking caused disease is a consequence of exposure to toxin in the tobacco smoke. Addiction to nicotine is the proximate cause of these diseases. Currently, about 45 million Americans smoke tobacco. 70% of smokers say they would like to quit every year, but only 40% quit for at least one day. Some highly addicted smokers have serious attempts to quit, but are unable to stop for a few hours. Moreover, the 80% who attempt to quit on their own return to smoking within months, and each year, only 3% of smokers quit successfully. Why do people smoke? Tobacco addiction, like all drug addictions, involves the interplay of pharmacology, learned or conditioned factors, genetics, and social and environmental factors, including tobacco products, designs, and marketing. The pharmacological reasons for nicotine use are enhancements of mood, either directly or through relief of withdrawal symptoms, and augmentation of mental and physical functions. And with this being said, I spoke to a couple of smokers, and they mentioned a couple interesting factors. One person told me that for them to smoke is to like not breathe. So that addiction is very extreme, and is kind of is relatable to other addictions, like they pointed out. Now, the biology of nicotine addiction is nicotine acts on nicotinic cholinergic receptors, triggering the release of neurotransmitters that produce psychoactive effects that are rewarding. With repeated exposure, tolerance develops to many of the effects of nicotine, thereby reducing its primary reinforcing effects and including inducing physical dependence. Smoking behavior is influenced by pharmacological feedback by the environmental factors such as smoking cues, friends who smoke, stress, and product feedback. And products advertising. Levels of nicotine in the body in relations to particular levels of nicotine intake from smoking are modulated by the rate of nicotine metabolism, which occurs in the liver largely by means of the enzymes. Okay, I think now we're gonna get into the nicotine and the neurotransmitter release. So stimulants of the nicotinic cholinergic receptors releases a variety of neurotransmitters in the brain. One of them is the dopamine. Signals a pleasurable experience and is critical for the reinforcement effects. Effects that promote self-administration of nicotine and other drugs of abuse, as well as for compelling drives such as eating. Nicotine releases dopamine in the mesolimbic area, the corpus stratum, and the frontal cortex. The dopaminergic neurons in the ventral tegmental area of the midbrain and in the shell of the nucleus accumbens are critical in drug-induced rewards. Both regions have a role in perception of the pleasure and reward. Nicotine also augments both the glutamate release, which facilitates the release of dopamine, and the GABA release, which inhibits dopamine release. With long-term exposure to nicotine, some nicotinic cholinergic receptors become desensitized, but some do not. Other neurotransmitters that may be involved in nicotine addiction are the hypocretins, the neuropeptides produced in the lateral hypothalamus that regulate the stimulatory effect of nicotine on reward centers in the brain, and modulate self-administration of nicotine in rodents. Okay. Now we're gonna cover neuroadaptation. So with repeated exposure to nicotine, neuroadaptations, which is considered the tolerance to some of the effects of nicotine, develops. As the neuroadaptation develops, the number of binding sites of the nicotinic cholinergic receptors in the brain increases, probably in response to nicotine mediated desensitization of receptors. Desensitization NCADD induces closure and unresponsible of the receptors is believed to play a role in the tolerance and dependence. The symptoms of cravings and withdrawals begin in smokers when desensitized. Nicotinic cholinergic receptors become responsive during periods of abstinence, such as nighttime sleep. Nicotine binding of these receptors during smoking alleviates cravings and withdrawals. Nicotine withdrawals causes anxiety and stress, both of which are powerful incentives to take up smoking again. The negative effects that typifies the response of nicotine withdrawal probably results in part from the cascade of events involving increased levels of extra hypothalamic corticotropin releasing factors and increases binding of the CRF to corticotropin release factors. Now we're going to talk about the clinical aspects of nicotine addiction. Smokers' use is to moderate levels of arousal to comfort mood. Smoking improves concentration, reaction time, and performance of certain tasks. Relief from withdrawal symptoms is probably the primary reason of this enhanced performance and heightened mood. Cessation of smoking causes the emergence of withdrawal symptoms, irritability, depression, mood, restlessness, and anxiety. The intensity of these mood disturbances is similar to that found in psychiatric outpatient anhedonia. The feeling that there is little pleasure in life can also occur with withdrawal from nicotine and from other drug of abuse. The basis of nicotine addiction is in a combination of positive reinforcements, including enhancements of mood and avoidance withdrawal symptoms. In addition, conditioning has an important role in the developing of the tobacco addiction. Okay, now we're going to get into the craving part of the nicotine. So, induced by smoking cues, stressors, or a desire to relieve withdrawal symptoms triggers the act of smoking a cigarette, which delivers a spike of nicotine into the brain. Nicotinic cholinergic receptors are activated, resulting in the release of dopamine and other neurotransmitters, which in turn causes pleasure stimulations and mood modulations. Receptors activation also results in the development of new citrus and associated with environment cues and behavior conditions. In the time between smoking cigarettes or after quitting tobacco use, brain nicotine levels decline, which leads to reduced levels of dopamine and other neurotransmitters and to withdrawal symptoms, including cravings. Conditioning behaviors. When a person who is addicted to nicotine stops smoking, the urge to resume is recurrent and persistent, long after withdrawal symptoms have dissipated. With regular smoking, the smoker comes to associate specific mood, situation, and environment factors. Smoking-related cues with the reward effects of nicotine. Typically, these cues trigger relapse. The association between such cues and anticipated effects of nicotine and the resulting urge to use nicotine and constitute a form of conditioning. Nicotine also enhances behavior responses to conditioning stimuli, which may contribute to compulsive smoking. Furthermore, the studies in nicotine-dependent rats show that conditioning stimuli associated with nicotine withdrawal increases the magnitude of the withdrawal through the elevation of the brain reward threshold. Thus, cues associated with nicotine withdrawal can decrease the function of the brain reward system. The desire to smoke is maintained in parts by such conditioning. Smokers usually take a cigarette after a meal with a cup of coffee or an alcoholic drink, or with friends who smoke. When repeated many times, such situations become a powerful cue for the urge to smoke. Aspects of smoking itself, the manipulation of smoking materials, or the taste, smell, or feel of smoke in the throat, also becomes associated with the pleasure effect of smoking. Even unpleasant moods can become conditioning cues for smoking. A smoker may learn that not having a cigarette provokes irritability and that smoking one provides relief. So this is where I connect a lot of the smoking cessation to if they're using drugs to, you know, that feeling of irritable, frustration, and discontent. And for some individuals that have both issues, you know, it becomes a problem for them because you know, they're connected together. And going on into the tobacco addiction cycle, smoking is highly efficient form of drug administration. Inhaled nicotine enters the circulation rapidly through the lungs and moves into the brain within seconds. Rapid rates of absorption and entry into the brain causes a strong felt rush and reinforces the effect of the drug. The smoking process also provides rapid reinforcement and allows for precise dosing, making it possible for a smoker to obtain the desired effect with toxicity. In addition to delivering nicotine, the brain quickly cigarettes can be designed with addictive and engineering features to enhance its addictiveness. The pharmacological basis of nicotine addiction is thus a combination of positive reinforcements, such as enhancement of mood and mental or physical functions and avoidance of withdrawal symptoms. When nicotine is not available, okay, the first cigarette, excuse me, the first cigarette of the day has a substantial pharmacological effect, the primary arousal, but at the same time, tolerance to nicotine begins to develop. A second cigarette is smoked later at a time when the smoker has learned that there is some regression of tolerance. With subsequent smoking, there is an accumulation of nicotine in the body, resulting in a greater level of tolerance and withdrawal symptoms before more pronounced between successive cigarettes. Smokers tend to take in the same amount of nicotine from day to day to achieve the desired effect. They adjust their smoking behaviors to compensate from changes in the ability of nicotine. When switching from regular to low yield cigarettes to regular the body's level of nicotine. They smoke primarily and associate with particular activities, after eating a meal or while drinking alcohol, and are less likely to smoke in response to negative effect. Although withdrawal symptoms may not be prominent, many light or occasional smokers have difficulty quitting. Some of them have a high level of dependence, but the pharmacological that differ from those in heavier smokers. Vulnerability to addiction. Tobacco use typically begins in childhood or adolescence. 80% of smokers begin smoking by 18 years old. Although 2/3 of young people to try cigarette smoking, only 20 to 25% of them become dependent daily smokers, usually as adults. Risk factors for smoking in childhood or adolescence include peer and parental influences, behavior problems, such as poor school performances, personality characteristics, rebellious, risk-taking, depression, and anxiety, and genetic influences. Tobacco addiction is highly prevalent among persons with mental illness or substance abuse disorders. The mechanism of this association are likely to include a shared genetic predisposition, the capacity of nicotine to alleviate some psychiatric symptoms, and the inhibitory effect of tobacco smoke of monoamine oxidases. Smoking behavior in women is more strongly influenced by conditioning cues and negative effects. Men are more likely to smoke in response to pharmacological cues, regulating their intake of nicotine more precise than women. On average, women metabolize nicotine more quickly than men, which may contribute to their increased susceptibility to nicotine addiction and may help to explain why among smokers it is more difficult for women to quit. So that's pretty much what I got. But you know, when I was doing this research, what I gathered is there's a lot of similarities to smoking and to every other addiction that's out there. Um, and when I was reading this, and when I was talking to some of my clients that struggle with quitting smoking, one thing that came certain is that one person told me, you know what, I quit using drugs. I can't quit smoking. You know, I just need that instant gratification. And you know, but on the other hand, they were able to identify that there's a lot of triggers there because they will smoke cigarettes while they were using meth, for example. And you know, it is a vicious disease. And until they start seeing the negative effects of their tobacco smoking, for them, nothing's gonna change. And then I'll end it with this. You know, one person told me that it's part of their culture. You know, their parents smoke, their uncle smoke, everybody in the family smokes, so they'll feel like an outsider if they stop smoking, even though they want to stop. So, you know, their vulnerability to addiction is very high. But you know, that's pretty much, I'm gonna wrap it up with that thought.
Thank you so much, Ralph, for sharing that information. There was a lot, which was really great, and hopefully people are able to, you know, really listen to what you were saying. You had a lot of really great information in there, and pull things from what you were saying and say, oh, okay, well, I can make connections with this, and maybe this is, you know, what's going on in my brain when I have this going on. So that's really awesome. And we are excited to also have Catherine Carney on to present. Hi, Catherine.
Hello. Sorry, I was having a little bit of difficulty logging on this morning. I had to update the laptop, but it got it done just in time, so all's well.
Perfect. Well, the floor is yours whenever you're ready. Feel free to begin.
Okay, so I'm going to be presenting on nicotine effects on mental health. So more than 1 in 3 adults with mental illness smoke cigarettes compared to 1 in 5 without mental illness. Most individuals are aware of physical health risks associated with smoking, but what about mental health? So research shows smoking also affects mental health. Understanding why many people smoke can help us better assist those that want to stop. So why? There is no single easy answer to this question. The reason that people smoke vary from person to person. So smoking and nicotine. So nicotine and how it biologically factors involved in the brain respond. Nicotine reaches the brain in just about 10 seconds. So let's talk about what happens exactly when our brains and bodies are introduced to nicotine. So at first, nicotine improves a person's concentration. It decreases their anger and it reduces their stress. It relaxes their muscles and it often will reduce their appetite. So what can a person expect from withdrawals? It's important that we know what to expect so we can help them to have the best coping skills as they arise. So they can expect cravings possibly as soon as 30 minutes after their last use. They can experience tingling in their hands and feet, sweating, nausea, abdominal cramping, headaches, and increased appetite. So what are some of the factors involved in whether a person becomes a regular smoker? So many young people start just by experimenting, but there's other factors such as, do they have friends or relatives who smoke? Growing up, what are the parents' attitude on smoking? Are they misusing or abusing any drugs or alcohol? Also, poverty and stress can be contributing factors. Smoking and stress. Smoking can be a way for many people to self-medicate to ease their symptoms of stress. Self-medicating to ease the symptoms, stress is common, affecting us when we feel unable to cope with certain pressures of daily life. Stress can cause physical symptoms such as headaches, breathlessness, irritability, anxiousness. Long-term stress can lead to anxiety and depression. Smoking and anxiety. Nicotine provides immediate sense of relaxation, which causes a false belief of reduction of stress and anxiety because it reduces the symptoms. Smoking nicotine actually increases anxiety and tension once the temporary relaxation has been gone. So this gives way to withdrawal and increased cravings. Continued smoking reduces the withdrawal symptoms. So when they start to experience the withdrawal, they'll smoke again. These are similar to the symptoms of anxiety, but it doesn't reduce anxiety or deal with the underlying causes of the anxiety. Smoking and depression. Smoking rates are nearly double for adults with depression as without. Nicotine stimulates release of dopamine. Most people begin smoking before signs of depression. And dopamine is involved in triggering positive feelings. Often people with depression have low levels of dopamine, and smoking temporarily increases these levels. Smoking and schizophrenia. People with diagnosis of schizophrenia are 3 times more likely to smoke and have heavy smoking compared to those without a diagnosis. Often smoking to control to manage their symptoms of their illness, or they smoke to reduce some of the side effects that they may be experiencing from their medications. So some facts are tobacco smoke can interact and inhibit effectiveness of certain medications taken by individuals with mental health conditions. The most common causes of death among individuals with mental health are heart disease, cancer, and lung disease, all of these which can be caused by smoking. People with mental health illnesses die up to 5 times earlier than those without mental illness, and many of those deaths are caused by smoking cigarettes. People with severe mental illness who smoke die almost 15 years earlier than those without mental illness who don't smoke. Individuals who have mood disorders such as psychosis, anxiety, developmental diagnoses, and substance use disorders are more likely to become addicted to those than without. So what can we do to help them to quit? We can tell them about the smoking cessation treatment, provide counseling or refer them. There are FDA approved medications available. Also, we can contact the CDC and Prevention and Health Promotion Office on smoking. There's their email and also their phone number. Also, it's good to be aware that people with mental health, they may require a little bit longer treatment than somebody without the mental health. So don't get discouraged if it takes a little bit longer. There's always hope.
Thank you so much, Catherine. That was super awesome information. I think it's really important that you touched on, how smoking affects mental health and things like that. Because I think something that we hear often, especially from our young folks, is that smoking helps them with certain like mental health challenges that they have. And so, and all of the presentations we've heard today, everyone has said in some way, shape, or form that may not be true, and it's really not true. So I think it's super awesome that you touched on that. So thank you both so much for being here today and sharing this information. Ralph, thank you as well. Super amazing information, and just thank you for your time. And I know it's going to definitely help someone out there listening today. So super awesome. Next we have Atticus. So Atticus will be doing some tobacco trivia. Atticus O'Daniel works for the National Council on Alcoholism and Drug Dependence as a project specialist for the tobacco and secondhand smoke education projects. They received their Bachelor of Science in Community Health Education from Cal State Long Beach, and they love working in public health because they want to create equity and social justice for underserved communities. So thank you so much, Atticus, for being here today. The floor is all yours.
Yay!
Good morning. Thank you so much for having me. Super excited to be here.
Good morning. So I just made you the co-host. You can access your poll.
Oh, great.
The polls.
Great. Oh, beautiful. I love it. So much fun. Okay, perfect. So we will be launching the poll after I give my presentation. Oh, I'm super excited. Okay, so I'm ready when y'all are. Perfect. Okay, let's see here. Okay. Shay, are you assisting with? Okay, great. Thank you so much. I just wanted to double check.
Just let me know when you're ready.
I am ready. Thank you.
Okay. Oh, so I am going to actually do your slides, right? Okay.
I'm sorry?
I'm doing your slides.
Yes, please. Thank you.
Just making sure.
Yes.
I will be pulling it up right now.
Perfect. Thank you everyone for your patience. My computer doesn't like PowerPoint anymore once I updated it. So thank you all very much for your patience and understanding. We'll get started shortly.
Okay. I apologize, everyone. We actually
If everyone's okay with PDF, I do have it via PDF.
I was going to say that I have your PDF as well.
Oh, wonderful.
And not. Okay, so.
No problem.
Wonderful. Can everyone see the screen?
Perfect. Great. Thank you so much. Perfect. Thank you so much, Shay. I greatly appreciate it. Okay. So welcome, welcome. So today we're going to talk about some things that you may not actually know about the tobacco industry and its history and some health effects as well. So to start out, tobacco actually has a long-standing history. It's centuries old. As we know, it's very much a traditional thing in certain cultures. And it hasn't really been really a social activity for the Americas, and also in quick ways to enjoy smoking, right? As people have been made to become addicted to it. So in actually the early 19th century, 1940s, during World War I and World War II, the big cigarette companies from the UK, like R.J. Reynolds, they were actually putting cigarettes inside soldiers' MREs, which stands for meals ready to eat. And what the kit consisted of back then was, and even still to this day, are essentials like their food, hygiene products, as well as vitamins, so nutrients, right? But they were giving free samples of cigarettes inside those products. And that actually led to high rates of addiction at that point. And then it became more normalized as a societal norm after that, once the soldiers got back from the war. Big Tobacco has been using very predatory marketing tactics for a very long time, decades and decades, actually. There have been products made by Big Tobacco to target certain communities, such as Virginia Slims. They were actually created and marketed specifically towards women. They had slogans such as like, you'll be more thin if you smoke. It'll decrease your appetite. So give the idea of you'd be more attractive if you lost more weight, and this is how you can achieve that goal. And then they've also targeted to African American communities as well, like such as Kohl's and Newports. They're marketed as refreshing, but they're also marketed as being a part of the African American community. And that has been longstanding for decades. For example, I've seen ads that around the civil rights movement and Black Panther members, they're used as like an embodiment of power. And how can you be powerful? Well, you can smoke a cigarette, and that'll give you more confidence and energy to do what you need to do. And they've gone about marketing in a variety of other different ways. They do promotional ads, they use social media, they are in lower income neighborhoods and neighborhoods of people of color more often, and they've given away free samples. They are like, and also retailers, they're more prevalent in lower income neighborhoods as well. They're actually more common than Starbucks and McDonald's like combined, which I found very, very interesting. They have a bunch of promotional ads in their windows from like top to bottom, and they add a bunch of sales and coupons as well. And they spend billions of dollars on marketing every single year to get people appealed and hooked onto their products. And the old tactics that they were using for their cigarette products, they're using now on their vape and e-cigarette products. And what's interesting to note is that actually when cigarette smoking was on the decline, they were worried about having lifelong users. And so they actually bought out e-cigarette companies. So now the tobacco industry and the vaping companies are one and the same. And so the tactics they use, they still do promotional ads and social media and discount codes and all these other things, which is very alluring to youth and teens and young adults. And they're the highest users of using these products, and which is very addictive, as we have come to find out, and also very harmful. And so now we're going to talk about some secondhand smoke effects on humans and pets. So on humans, as we know that it harms the lungs and heart disease and stroke, but and then with pets, the nicotine and all the cancerous causing chemicals, they actually can leave on the fur, and they lick the fur up and it gets ingested. And then in terms of cigarettes and the products themselves, if they ingest a cigarette butt, they can actually get really ill and get nerve damage, and unfortunately may even pass away. But what's interesting to note with humans that smoke is that you can actually get worsening eyesight and decreased sensation in your taste buds, and actually erectile dysfunction as well. Perfect. I know it was brief and short and I had a longer time frame, but thank you so much. And so we have our poll for our first round of questions. I'll put up right now. So please let me know if you have any questions, and we'll get started on the poll.
Everyone take your time and answer these. Tell us what you really think.
And we'd love to have a discussion after as well, if you like. That'd be awesome.
Yes. So we don't have any answers yet. Just waiting for people to fill in polls. Okay. Well, we've got someone on here who knows all of the answers.
Yeah, we can go over them as well. So I'm going to end the poll. Perfect. Okay. All right. Thank you to those who participated and seems got 100% correct. So that's awesome. Perfect. So let's see here. Yeah, soldiers did get hooked in the First and Second World War due to being put in the MRVs. And then, yeah, Virginia Slims were marketed to women and Cools were marketed as refreshing. Awesome job, everyone. Perfect. Okay, perfect. Okay, so the tobacco industry does spend trillions of dollars every single year on marketing. And that's because of all the different facets and avenues that they market their products. So it's like social media campaigns and the promotional ads and sales. It's just constant all the time. And then the research as well goes into that as well. And then, see, perfect. Okay, great job, everyone. Congratulations and thank you so much for your time. Hope you learned something fun and new.
Thank you so much, Atticus. We're glad to have you. And now we're going to open up for discussion. So I have a couple of questions.
Yes.
Well, I guess we'll ask whoever wants to answer. This is just really, really open. Who has known someone that smokes any particular brand, like they won't smoke any other type of cigarette? Does anyone know anyone that will only smoke one type of cigarette? You do.
Yeah.
What is their preferred brand?
Marlboro Red.
It's so hard to say.
How do you say that? Because I can never pronounce it either.
To my knowledge, it's Marlboro. Marlboro. That's how it's supposed to be pronounced, but I don't know who thought of that. Shame on them. It is really interesting because I think, like you've done with your research, you know, because certain brands are marketed to certain populations, you will find as you go across cultures that maybe people within a specific population only smoke one type of cigarette, or that they may scoff at someone smoking a different brand of cigarette. And it's not the same though. So the tobacco company, you know, kind of became hip to that because what they did instead was they said, well, we'll do vaping. And that way, you know, there's far greater access and there won't be one type of brand. We'll just have it all over the place. And so very smart of the tobacco companies, but really awful for the health of our communities and populations, right?
Yeah.
I would love it if our guests would chime in. Tiffany, Devancia, anyone, any thoughts about tobacco use? Any thoughts about the health of those who are around anyone who's exposed to secondhand smoke or thirdhand smoke? Or brand or anything really?
Newports.
Yes.
Yeah.
Yeah.
Oh yeah. Very, very popular, and they're made to seem like it's very much a part of the community, like it's like normalized, like it's part of their identity, and that's like how they marketed the product.
Right.
Which, yeah.
Mentholated.
Mentholated.
Yeah. Anything that's mentholated. Oh, hi, Belinda.
I'm so sorry. My Zoom just shut down.
No, it was nice seeing two of you.
Yeah.
Yes, twice the Well, I'll say the zest because you're zesty. So that's why.
Thank you.
Twice the zest. I see that Jessica is here. Hi, Jessica. Thank you for being here. We want everyone just going to kind of repeat this. We are going to be sharing this. We're recording it instead because we figured that people might be busy or, you know, might have a lot going on. And I'm going to, at some point, try to share the recording today on Facebook, on our Instagram, however we can do it, we're going to share it. So, you know, we'll reach a lot of people and just really excited. So Jessica, we're just talking about branding, and do you know how to pronounce Marlboro?
Oh gosh, no. That's probably the like one of the biggest things that I avoid saying in presentations so that I don't have to say it.
Yeah. And Devancia, you don't have to speak out loud if you're not comfortable, but if you would like, that'd be great. But no worries there. And I agree, I have seen Newports as very synonymous with Black culture as well. So thank you for bringing that up, because I feel like that's very important to discuss.
Right, it is. And yes, we are encouraging everyone to please unmute yourselves as long as it's not during a presentation. We want to hear from you. This is all about community outreach and engagement and ensuring that everyone is heard, that all questions or inquiries are met with responses. And, you know, this is really what we're here for. So please speak out, speak up, and we're glad to hear from you.
I have a question regarding secondhand smoke and even maybe thirdhand smoke and pets. Can you guys share a little bit more about that?
Yeah, sure. I did see Devancia raised her hand. Devancia, would you like us to answer this first, or would you like to go first? Okay, thank you so much. Okay, yes, Belinda, what is your question?
I was curious because I know that's something that not a lot of people know about is like the secondhand smoke affects their pets and things like that. Have you all heard of any stories or, you know, of how this affects pets?
So it's funny that you ask. Oh, go ahead.
Oh no, you can go ahead as well if you like.
So I actually have a presentation that I'll share really quickly. It's very brief. I was hoping someone would ask about the pets.
Yes, pets.
So I am prepared.
That's good. I know that they are more likely to get nasal cancer and like lung cancer because their snout and everything's so short and they're so small. And this is still, to me, like types of smoke. You know, when we had the fires, my dog actually was sneezing and coughing quite a bit. And so that was something that was worrying me about his health. And so I try to keep him inside as much as possible.
Right. Welcome, Kimberly. We're glad to have you here. So Belinda just asked about pets. And just gonna do just a very brief presentation because Jessica will be discussing a whole bunch of a wealth of information with us actually about flavored tobacco. So disregard the date on here, but so here's a few interesting facts about pets and pet health. So did you know that there is no safe level of exposure to secondhand smoke? Of course we know that, right? Or maybe we don't. According to the report of the Surgeon General, there is no safe level of exposure to secondhand smoke, which is really important. But what about our pets? So research done in recent times has concluded that secondhand smoke is not safe for animals or pets. So one of the things that we really want people to know with this is that it's not just human beings that are impacted by secondhand smoke. It is literally everything that breathes, and this includes plants. And so I know I'm kind of digressing, but I just wanted everyone to be aware that it does span that far and it is that deep. So I wish I could play this video, but I can't because of the PDF, sorry. But yes, animals who are exposed to secondhand smoke have a greater likelihood of developing nasal cancer, lung cancer, tumors for cats who, as Atticus mentioned, are grooming themselves. And so since they are doing that grooming, all of those chemicals are going on, they're being ingested, they're getting into their bloodstreams, and they're making direct contact with their mouths. And of course, as it is with humans, additional nasal and respiratory irritation does happen to occur. So, the CDC and the FDA says, hey, please keep your pets away from smoke and keep your smoke away from your pets. They'll appreciate you. And, there have been a number of studies done, and I don't want to say too much because I don't want to give away my presentation for later, but there has been just a lot of research done on health effects. And, I know that we kind of hear them, but a lot of times we don't see them. And so we don't know how horrible it is for maybe a pet to develop a tumor, right, on their tongue. Can you imagine your puppy or your cat and they're now stuck with a tumor because they've been ingesting secondhand smoke residue? So, one of the things we know people experience or barriers is that there's a lack of access to demonstrations or lectures, speeches, reports. Everyone doesn't know where to find this information. And so actually later on, I will be kind of doing a few brief tours just to show people some websites that they can look at. But anyhow, just look at all the pets. Keep your pets in mind if you have pets. If you know anyone who smokes around their pets, let them know that, yes, even the goldfish, it gets into their water. That's icky. Can you imagine tasting cigarette butts or whatever residue might be around as a pet?
Thank you so much. Yeah, thank you
Yeah.
so much for answering that. Because I know it's something, I work in the field of prevention and things like that, but the fact that it affects your smoke was something, or not your smoke, the fact that smoke affects your pets was something very new to me. And so, very interesting facts, because when I tell my students that, they're like, what, like my, my bunny or my this or my that, and that's something that like really pulls at their heartstrings. So
well, let them know it is confirmed, and you can have access to those slides or PDF or whatever it is if ever you want, because I know no one wants to go and find a whole bunch of new animals to put in a PowerPoint. So feel free to take it and just share it with them. Hi, Andrea. Andrea is still connecting to audio.
Perfect.
So
thank you.
Oh, Atticus, I was going to say, do you have anything else that you'd like to share? You still have some time.
I don't presently, but I do see Devancha's hand still raised, so I just wanted to give them the floor.
Oh, yes, please. I'm so sorry, Devancia.
Oh my goodness. I'm not going to turn my camera on, but I will unmute.
It's okay.
Just a moment. I have really enjoyed all of the presentation thus far. I feel like I've learned a lot when it comes down to branding and target marketing when it comes to tobacco products. I think that that's something that really is important to emphasize, because people sometimes are a little more receptive to the understanding that they're being programmed if it's brought to their attention. So I think that was, a fantastic thing to point out. And then too, I hadn't really considered, I have 2 cats myself, the effects of secondhand smoke so much. I know that they do not like the smell. I don't think that I've ever seen them just sit there if they smell it. They usually will get up and leave the room. They're pretty intelligent cats. So I just wanted to kind of add that they do know what's best for them. And for that reason, you'll see them get up. So of course, there's some discomfort that you could kind of sense is being caused immediately. I don't know how to put my hand down.
It's okay.
I don't know how to take it
I'll
off.
lower it for you. There you go. Thank you so much for sharing. Devancia, it's really good that you now know, why the cats are getting up and leaving, and what it is that might be bothering them, and that it's not I mean, it may be the smell as well, but it could be that they are feeling a little bit uncomfortable or might be trying not to sneeze. Yes, cats sneeze too. So thank you for sharing that with us. Hi, Andrea.
Hi.
Your screen is frozen.
I know.
We're glad to see your face,
Zoom
though.
is trying to play me today. Oh, am I back?
Yes, you're back.
Hi, everybody.
Oh, wonderful. We have another guest joining us. Hello. Welcome. I don't know if your name is Janet or Jeanette, and I don't want to mess it up. So thank you for being here.
Okay, should we go on to the next presentation?
Yes, it is time.
Okay. Jessica, are you all set? Do you have co-host abilities? Shay, can you?
I will be, yes, I was going to say it. I do need to do that. Thank everyone for your patience.
Thank you everyone for having me. I will be back around 5 o'clock.
Thank you for being here. We're looking forward to
Thank you so much, Atticus.
Thank you. Have fun. Bye.
Thank you.
Okay, so now we have Jessica here today with us, and we're super excited to hear all of the information that she has to present. So Jessica, I don't want to mess up your last name. Is it Vozella?
Vozella.
Okay, perfect. Jessica Vozella is a specialist with the American Lung Association. The American Lung Association is working to save lives by improving lung health and preventing lung disease through research, education, and advocacy. In efforts to create a tobacco-free future, their San Gabriel team specifically works to restrict youth access to tobacco in Laverne and Temple City. And today they will be presenting on facts and dangers of flavored tobacco products and the youth vaping epidemic. Today you will learn about education, policy, and how to take action to help yourself and your community. So Jessica, thank you so much for being here. The floor is yours.
Thank you for having me. I'm really excited to give this presentation. This is my second time presenting at the Bye Bye Butts event, so it's super exciting. And this year is just so packed with a bunch of really awesome presenters. So I feel honored to be part of them. I'm going to try to share my screen so that I can get the presentation on here. But it looks like I don't quite know how. So give me one moment.
We can see it.
You can see it.
Yeah.
But do you see the whole, is it possible to?
Yeah, the presenter.
Yes. I was going to say if you started, I think it'll just go. Yeah, we're
okay, like that. We're good.
Yeah, we're good.
All right, awesome. So like Belinda had already said, I'm a specialist with the American Lung Association, and my presentation will be on flavored tobacco today. And the reason we're talking about flavored tobacco is that, as we know, tobacco is an issue in our communities, and that a lot of times we know that smoking is bad for us, but we don't really see flavored cigarettes anymore because in about 2009, it was banned by the FDA because it was determined that flavored cigarettes actually attracted youth, made it easier to start using tobacco, which we know has lifelong and often fatal consequences. So unfortunately, though, the tobacco industry did answer, I guess, the demand, or rather they tried to compensate for that by creating this new product, an e-cigarette, often, and flavoring it. And there are some other types of flavored tobacco that we'll talk about, but really it's coming up again because while there were policies that were passed to ban these products and keep our kids and our adults safe, there are loopholes, and so we're going to explore that. So this is basically, we're not quite dealing with the same cigarette epidemic that we had before, which is great. Public health has done a lot of good work to educate the public and to restrict the use and the access to these products, these very dangerous products, to our society. But because like I said, the tobacco industry had created a new product and has new marketing strategies, things like that, the US Surgeon General actually declared this e-cigarette use amongst youth an epidemic. And they called for aggressive steps to protect our youth because what we're seeing is a product that potentially was created just as an innovation is incredibly popular amongst youth. And we'll find out that that is no coincidence. So it's not quite the same issue. Just to back that up, I think that the data really stands on its own. Cigarette use has been declining amongst high school students steadily. There's been a lot of really great education and policy to reduce the use of cigarette products by young people. But unfortunately, we see the graph for e-cigarette products skyrocket. And it really becomes popular between 2017 and 18, and we'll talk about why that is later. But the rates have gone much higher than cigarette smoking has been in a while. So currently the data, the latest data of 2020 reports that about 1 in 5 high school students, or 20%, in the US are using an e-cigarette in the past 30 days, which means probably that they're regular users. I am happy to report that this number is down from 2019, hopefully because lots of education initiatives have taken place, as well as policies to restrict the access to these products. But unfortunately, that still means 1 in 5 students is using these products. And nearly half of them say that they use them just because they taste good. And we'll talk about that because this presentation is about flavored tobacco. We'll see how that plays a key role in the youth vaping epidemic. One other thing is that a lot of people are sort of familiar with this e-cigarette, potentially the message that it is created to help smokers stop smoking. Now, like I said, it's not a coincidence that a bunch of youth are using these products, but only 10% of the youth say that they're using them to quit smoking. So why are flavors a problem? Well, flavors, despite just tasting pretty good, they help mask the naturally harsh taste of tobacco. And so we'll see that with menthol cigarettes, but we'll also see it with flavored e-liquids. So it just makes it easier to start using these products because they don't hurt as much. They don't sort of give you the feeling like you're doing something that's not good for your body because we've sort of been trained that, you know, sweet things taste good and aren't so bad for us. So this makes it easier for you to start using it, and it definitely makes it easier for them to keep using it. They even have done studies that show that menthol, which is that mint sort of flavor, makes cigarettes more addictive. Now, it's nice that Atticus actually just talked about marketing and branding because as they probably mentioned, we have this issue where not only is the flavors the problem because they taste good, but we also have all this marketing and all of this branding that is directly looking to our youth to sort of make some connections in their brains to say these products, not only are they not bad for you, but like they could be fun or tasty. So I showed this slide to middle school students when I do presentations, and they are super quick to point out that Candy King branding looks a lot like some of the flavored candies that they like. So they say, oh, that looks like Sour Patch Kids, Swedish Fish, gummy worms, things like that. And they've been taught that those candies are, you know, not only are they not like, maybe they know that sugar is not super good for them, but they don't think that it could cause a lifelong addiction or any health problems. So Candy King and other e-cigarette or e-liquid brands know that. And they're placing these ads, or rather using this branding and placing ads in places that youth are going to know or be able to see them. Now, to talk about what sort of products, tobacco products are flavored, we'll start with e-cigarettes because I did mention this youth vaping epidemic. The evolution of e-cigarettes have changed over the years. We started to see these e-cigarettes come on the market about 2007 in a product like the one on the top. It looks like a cigarette, a combustible, but it's called a cig-alike, and it actually is electronic. And oftentimes they're still disposable. You can buy them in a pack. And many companies still do make those. But as vaping became more of an interest to certain people, they began to make things like vape pens as well as mods and tanks so that there would be more customizable features about these. You can change some of the key ingredients in vapes to make a bigger cloud, to do certain tricks, to make these things look cool, customize them to sort of whatever you would really want, as well as add flavoring to them. Now, the vape pens and mods sort of had a vape culture attached to them, where people who were interested in using them, they had conventions and they had tricks and videos and all this stuff, almost separate before vaping became really big. Now, with the advent of Juul, which is the product right above the e-liquids, product that looks pretty sleek. I think it's often been compared to a USB drive, and one of my students one time mentioned it looks like a pack of like pencil lead. It looks cool, pretty harmless, which is intentional. And with the advent of Juul, it really, the market really exploded because of their advertising. And we'll talk about how Juul also works to be more addictive as well. And then finally, liquid nicotine solution, the things, the flavoring, the chemicals that go into these products that contain nicotine as well as some other chemicals and flavorings. So Juul, like I said, Juul has a very large part in leading this new epidemic. Not only was their advertising very similar to some of the older advertising that the tobacco industry used and has been determined that they no longer can use because it's has been outlawed. But Juul also contains benzoic acid and nicotine salts that actually reduce the harshness of this hit that might not be present in another vape pen or something like that. It actually makes it easier to smoke and therefore easier to keep smoking. And something that is very surprising, I think, to people who are not familiar with these products is that these pods actually equal the same amount of nicotine as an entire pack of cigarettes. And in certain studies on different products, they've actually shown that they have more nicotine. And so not only is it hard to regulate how much is being used, it's not the same sort of understanding that a whole pack of cigarettes equals just one of these small Juul pods, especially for young people. One other misconception I would say about vaping is that it's harmless water vapor. And I don't know if people are still under the impression that that's the case, because luckily there has been a lot of great education, but these products do not emit just a harmless water vapor. In fact, they are emitting this aerosol, and it's caused by heating a coil in the e-cigarette, and it's heating up this e-liquid, which I've mentioned contains a nicotine solution, flavoring chemicals, as well as any other chemicals that will make this into an aerosol. Studies have also shown that there are metal particles from the coil that are actually, when they're heated up, transferred from the e-cigarette into the user's lungs. So now we have all these products that are known to cause cancer and birth defects, reproductive harms, and other health issues that are being ingested into lungs. And unfortunately, because these products have only been around for not that long, there aren't the studies that we see for cigarettes that we can point to and say, okay, this causes gum disease. Look at the black lung that maybe a lot of people have seen related to smoking. However, there have been a lot of studies every year showing us that there are a lot of negative links from e-cigarettes to health issues. And another reason we're concerned about flavoring is that all of these chemicals, the whole, if you can't say it, maybe you shouldn't be ingesting it. All these chemicals, we don't know how they react when they are heated and inhaled. I love to bring out the example of a young person I presented to once, a middle school student, who said, so what is the difference between these chemicals maybe in our vape, and in our diet soda, let's say? And I think actually I had asked the question and one of the students had mentioned, oh, well, when I drink soda, I know my stomach digests it, and maybe my lungs don't. And that's exactly the answer in a simplistic form. Our stomach has acid, it has a whole digestive process. These chemicals can be broken down due to all of that. But unfortunately, when we inhale things into our lungs don't have any of that stomach acid. They don't have that filtration system. And so when things are inhaled into the lungs, they are then brought into the bloodstream without a lot of that filtering out. And also the chemicals might not change because there's no acid to interact with that. And so not only do we maybe know that these flavoring chemicals, what they do in the stomach because of years of research, we just can't know that about the lungs. And we also do know that when we put things directly into our bloodstream like that without breaking them down at all, that can be dangerous. One example that we actually do know through an unfortunate situation is diacetyl. And diacetyl is actually an approved food flavoring. It gives it a buttery taste in things like wine or popcorn. It used to be a major ingredient in flavoring popcorn. It is no longer used because of this situation. But essentially when popcorn factories were making this product and they were adding it to their popcorn, the product would be heated up. We know that because when you microwave popcorn, you have to heat it in order for it to pop. But what they were seeing as over time, the popcorn factory workers were actually developing this irreversible lung damage. And when they started to look into how or what that was caused by, they realized that the inhalation of this chemical once heated was causing the lung problems. And so it was fine to eat. They weren't having problems with the consumers of popcorn. They were having it with people who were around the chemical once heated up. So that's pretty problematic. But what is worse is that in a Harvard study, they found that diacetyl was actually found in 75% of these e-liquids. So not only did the companies know that this product, is great for tasting good, they also know that it caused irreversible lung damage in a large industry, and they still use it in their products. Now, e-cigarettes are not the only type of flavored tobacco product. A lot of people are familiar with menthol cigarettes. They were a major concession, I would say, in this policy that banned flavored cigarettes in 2009, and menthol cigarettes were exempted. And so they are allowed to be sold in a mint flavor. They also have cigars. So regular, those cigars that we're familiar with, they also have little cigars and cigarillos. Also flavored tobacco products are smokeless tobacco like snuff or snus, chewing tobacco, as well as shisha and hookah tobacco. And as far as flavors go, flavors are attractive to youth, but there has been some policy that has sought to make the access to these products more difficult for youth to access. And one of those such products or policies is banning the use or the sale of individual cigarettes. The tobacco company, when this policy was enacted, reacted by making their cigars look like cigarettes and selling them at a much cheaper rate and in things like individual cigarillo packages or little cigar packages. And so these products that are often flavored because they are cigars and were not included in this overarching flavor ban for cigarettes can often be sold for $3 for $1 or something that maybe a teen who has $1 in their pocket and looks at a cool product that looks flavored and tasty might want to try. And so cheaper and smaller pack sizes is another way that the tobacco industry can attract youth to their flavored products. Smokeless tobacco, I think, maybe is less thought of by just users of tobacco. I personally know people that say, oh, I don't smoke, but I chew tobacco. And that, unfortunately, tobacco, we know in almost all its forms is very dangerous. So these smokeless products contain at least 28 carcinogens. They lead to lots of cancers and gum disease as well. So we just want to be aware of that when we're educating people about the dangers of tobacco. And finally, another form of tobacco that maybe doesn't get talked about as much, I personally know that I didn't know, anything about hookah tobacco for a long while, even when some of my friends might have been saying that they wanted to go to like hookah lounges and things like that, is that hookah tobacco or hookah smoking is also smoking tobacco. Now, hookah does have cultural roots and history, but unfortunately, the industry has also taken to targeting young people, as especially college students. And teens that use tobacco or hookah are 2 to 3 times more likely to start smoking cigarettes and become current smokers. And as we know, as mentioned, menthol cigarettes are still on the market. They have a nasty history of being targeted to African American and LGBTQ communities by the tobacco industry. And a lot of young people, 57% of smokers who are between 12 and 17 actually smoke menthol cigarettes because, like I mentioned, they're easy to smoke. Studies have shown that perhaps they're even more addictive. So we know that lots of youth are using flavored tobacco if they're starting to use tobacco in general. And one thing that I didn't mention, but I should have mentioned earlier, is that we also know the startling facts that 95% of smokers start before they're 21. And so while we know that smokers are, the age to smoke was 18 and now is 21, we also know that if tobacco companies don't get their users before the legal age, they won't have the same users that they have now. If 95% of smokers are starting these products when they're young, when their brain is still developing and it becomes an addictive dependency on nicotine, they can ensure that they have these users lifelong. But we find that adults don't typically start smoking and keep smoking if they didn't start young. And so flavors are all the more dangerous because we know that they're more attractive to young people. So if 82% of current e-cigarette smokers have used a flavored e-cigarette, we have to ask what would happen if these products weren't on the market? What if they weren't flavored? Would people still be using them? Finally, we have to ask the question, so what can we do? Well, we know that if you are a smoker or you are a vapor, hopefully having the education will help you decide to make a choice for your own health and to quit using these products. We know that it's not easy, which is why the American Lung Association and lots of other organizations offer cessation resources, as well as support groups and more information. But we know that educating cannot be the only piece of this, because as I mentioned, all these products are all over the market. They have advertising, they have branding, they have colors and flavors. And also, if you see something enough, studies have shown that it makes it a lot more easier to try something if you're looking at the advertisement, all the time, or even if your friends are saying, hey, like this vape tastes really good, it's harmless. So we have to ask, how else can we protect our young people? There are a number of policy solutions that cities around the state and the country have enacted, one of which is a tobacco retail license. Now, not to get into the weeds of this, but essentially, if you're regulating your tobacco companies, you can also prohibit the sale of flavored tobacco. This would take the flavors off the market, such as the law in 2009 originally intended to do, because it is attractive to young people. And we know that young people are the ones that are starting these lifelong habits. Similarly, if we remember me talking about the little cigars versus individual cigarette situation, we can establish minimum cost and pack sizes for tobacco products that maybe would raise the price and less appeal to somebody who has $1 in their pocket if the product is costing $10, even if there are more products in the packaging. And finally, another useful policy is to restrict the sales and the placement of tobacco retailers that are near youth-sensitive areas like parks, schools, churches, dance studios, things like that. Because if we mentioned these products are less accessible, even just location-wise, or if they can't see advertisements when they walk out of school, they're less likely to want to try these products and less likely to have access to them as well. So that is the bulk of the presentation. I did want to let you know that we are doing a lot of this great work in Laverne, and as we mentioned in Temple City as well. But Laverne has its own coalition and its own social media that we encourage you to join. We have some information about vaping and about smoking, also other American Lung Association resources, and you can get involved in your community. If you feel like this is sort of an issue that you care about, Healthy Lungs Laverne is doing community meetings. We're doing presentations like this one. We're doing events. And we also offer volunteer hours if people are interested in volunteering a little bit to sort of help their community become healthier. So we encourage you stay up to date with us. We have a newsletter as well as some social media. So we would love to see you. Does anybody have any questions?
Sure, I have a question.
Sure.
Is it easy to join your coalition, or is it a process?
Yeah, well, so our coalition is essentially, we have our social media and our newsletters that go out to our coalition members. And our coalition members can choose as much or as little involvement as they want. So we do a lot of work. I had mentioned just different activities. But if you're emailing or you're joining our social media and you express interest, you can just direct message us. We'll start you on some of the information that we have, and then you can kind of choose to get involved with us. And we're not gonna hold anybody to have to attend our meetings or anything like that, because we really are just a group of community members who want to make a difference in the community.
Great, and I have one more question.
For sure.
So it's Bye Bye Butts Day. We're here to encourage people as they work to stop smoking. What piece of advice would you give anyone to encourage them to continue on in that direction?
Sure. So I think that when I talk to young people, especially about vaping, because we do know that most, not all, but most people who are a large part of the vaping population is a young person. I think that the encouragement that I would give is, one, is that this process is not linear. I had heard that before, and I thought that it was so helpful because a lot of people who sort of start and they desire to stop using these products, it can be really hard. And something that I often think is that the smoker themselves are not the ones with the problem. The products have been marketed to you, they have been made addictive, and they are quite literally meant to keep you as a lifelong user. And as we start to educate, sometimes the stigma can feel like a lot, but unfortunately, that's how the tobacco companies are working. And so we want to let you know that there's lots of resources for you, and that even if you aren't able to just quit cold turkey, like maybe your neighbor, or your grandmother, or somebody like that, each process is different. And that you definitely will be a lot happier in the long run when, or if you're able to quit.
Great, that's great, Jessica. Does anyone else have any questions? We are encouraging everyone to join in. Again, I just would like to continue to encourage people to speak, because other people will have the opportunity to view this and get insight, and we want to help as many people as we can. So the floor is open to anyone.
I have a question.
Yes.
I'm curious about parents and maybe how they should sort of bring up this conversation with youth, because we know that the industry does target youth populations.
Mm-hmm.
What do you think is the best way or the best route to go for parents who want to sort of have open dialogue with their kids about flavored tobacco products?
That is a really great question. In fact, the American Lung Association did just release this whole campaign essentially to sort of address parents, because one concern, I know, Andrea, this isn't quite your question, but one concern is that people hear this and they say, my kid would never vape. And I think that understanding really how the system is actually set up so that the youth are, their defenses are down in a sense. They look at these products and they are being told by this industry that they are safe, that they are tasty, all of these things. I think that it's important for parents to realize that it's possible that your kid is vaping. Not only that, but it's not a problem. It's not your child that is the problem. It is not your parenting that is the problem. It is simply this industry. And though I'm sure there are lots of methods, I think just being honest and recognizing that youth know a lot of things about these products, probably almost positively more than parents do. And I think just opening up a conversation, just asking, you know, have you seen kids at school vaping? If you're not comfortable just asking them straight out about, are you vaping? I think you can talk about the industry and how these companies are actually relying on these youth as almost guinea pigs, because they don't actually know what their products are going to do. They don't know what they're going to have to face in the future as far as health concerns. And oftentimes I've found that I've talked to teachers who think when kids are aware, or students, I should say, are aware that they are being manipulated, or they're part of a system that is actually not meant to benefit them or really use them, they kind of pick that up. They don't want to be manipulated. They want to know the information. And I've met so many students who, after they hear things, they want to tell their friends because they feel passionately about this. And so I think an honest conversation that isn't revolved around like discipline or, the stigma of like, oh, like you're bad because you do this, can be a really good way to at least broach the conversation and have it be a repeated conversation.
Thank you.
Thanks for asking. That's a great question.
Jessica, you are a fantastic presenter. You have provided us with a wealth of information. It's been exciting to sit here and listen and absorb a lot of what you've shared, and being in tobacco prevention myself, I still learned something. So I know that for those who are not, this is not really their professional world or any realm that they're in, you have so much to offer, and all of our presenters have had so much to offer, so much great information, and we're just really thankful to have you.
I really appreciate that.
Absolutely. So we have 8 minutes left, and we're just opening the floor. Anybody who wants to share, again, this is an interactive experience. We want you to share what your thoughts are. We want you to share your concerns. We want you to, give ideas and thoughts as to how we can better help people, better serve the community. All ears are open.
Yes, I think Devancia, do you have your hand up?
I do. I'm not great with working this technology, but I'm in here.
No worries.
I do have a question. I know that recently the limitations for vaping have come up in terms of legislature. Do you by chance have any status information on what's going on with that, or maybe if they've already started to put a strategy together, what that strategy might look like?
Absolutely. So there was actually, at least in California, the governor actually recently signed a bill that would ban flavored tobacco products, which is a really great policy. And that essentially on the state level would prohibit retailers from selling flavored tobacco products, including menthol cigarettes, which I think is one of those correcting something that was meant to happen in 2009. And that's a really great step. I would say, unfortunately, due to a number of reasons, it can't be the only action that is taken. One major thing is that the tobacco companies in the industry have a lot of influence and a lot of resources and money. And they actually are fighting the bill itself. And so due to the legislative process and the type of signing of the bill that this was, if the tobacco industry or whoever, I suppose, collects enough signatures opposing this bill, it will actually go to a vote to the people in 2022, I believe. And they will be able to vote if they want this policy or not. And so number one, that is just that the policy might not go into effect or even be in place. but a lot of people don't know that. And then second, I think that it's really important to focus on local legislation, because local legislation is easier to tailor to your specific community, and you can also enforce it better. And you can enforce it more justly as well, because there are a lot of issues with equity in terms of how these policies are enforced. And so with a local policy, you're able to sort of see, okay, this community actually is really focused on like vaping products, and they can include more regulations or restrictions around the devices themselves, or they can really talk about like flavored, those little cigars, and they can say, you know, we're actually going to have a minimum pack size and things like that. And then also, unfortunately, just because the state is so large, the likelihood that these these retailers would actually be checked that they are no longer selling flavored tobacco products is actually pretty slim. And so while this is a great policy and that they do have intentions to enforce it and to make it happen, it also is not just like a catch-all or just like a one-stop solution. But that's a great question. I'm excited for the state. I think that they're really trying to protect their community.
Thank you. I remember voting, even though I do smoke cigarettes, I voted concerning the vaping because I tried to use the vapes to stop smoking cigarettes. And actually, I noticed that it affected my body in worse ways than with smoking cigarettes. And I'm someone that smokes half a pack a day. I smoke Newport, very strong cigarettes. So I said, oh my gosh, well, what would happen if these were, you know, in the hands of children who do not smoke like I smoke? I could see a lot of children being sick. I was suffering from nausea, which even though I smoke an incredibly strong cigarette, doesn't happen. So I was really worried. I had bought so much of the little vaping juice because I wanted to quit, and I threw it all away. I threw the whole thing away. I spent a lot of money and I threw it away because I said, okay, I don't know what's going on here, but this, even though they tell us it's safer, seems a lot more dangerous. I thank you so much for answering my question. I was just wondering because I had seen that it passed, but I said, but I still see the flavored stuff though. And I want to know when it's gonna go away. I just don't want children, you know. I think when we're adults and we make that decision, we decide to harm our bodies. And even though it's not any more acceptable, it's a decision that we make in conscience. Whereas with children, that's not always the case. They don't know. And maybe they're not as in tune with their bodies to understand what's happening as I was. So my concern is, you know, getting it off the shelves, not so much in the protection of adults who can make that decision for themselves, but for children who maybe don't really have the ability to make that kind of decision. I have children that I would not trust to decide to have surgery, so I definitely would not trust their decision if they decided to vape or smoke. You know, so totally, I'm enjoying all of this, and I really enjoyed your presentation. Thank you so much.
Devontae, I really appreciate that. Actually probably the best part of my job is speaking to people about these products, because while it is just maybe a public health thing, some education that I learned, I've learned the most from young people and not like high school students, older people too, who talk to me about the effects of these products. And it makes me very frustrated in the sense that their brains are still developing. These products are being marketed to them. And so much so that I was speaking with some high school students, and they were talking about how they know friends who can't study without vaping. They know people that can't be away from their vape. They get super irritable. And then of course, we know that there was the entire vaping associated pulmonary illness that was going, not around, but like was happening and was in the news. There were young people that were being hospitalized for these products because they're not told that they're dangerous, or when they do, there's already that addictive part of it. And so anyway, I just really appreciate your testimony. So I appreciate that.
Well, this has been so wonderful, and we've made it to 12 o'clock. So Belinda, thank you. You've been a wonderful host, co-host. Well, you've been hosting. Thank you. You're
Thank
completely.
you so much for having me, and it's super awesome to hear everyone share their presentations, their information, their testimonies, and their stories. So I know the rest of the day is going to be just as great.
Yes, and maybe we'll see you back around 3. Who knows?
Maybe.
Thank you everyone for showing up, and for those who will be watching this recording, we will be back momentarily. Take care, everyone.
And Belinda, I really appreciate this.
Thank you,
Thank
Jessica.
you. Bye, everybody.
Thank you everyone else for showing up. So we are so glad to have our next presenter. His name is Mr. Lionel Newman Jr. He is a respiratory care practitioner and neonatal specialist whose presentation will be centered around maternal smoking and fetal health. He is currently practicing at Providence Tarzana Cedars-Sinai, and he has a wealth of experience. Welcome, Mr. Newman.
Thank you, Ms. Green. First, let's start off by thanking actually Tri-Center Medical Center Health and Ms. Donashay Green and the project coordinator, as well as NCADD, the ALA, and Day One for inviting me to participate in this great event today. I also like to thank my wife, Phyllis, for allowing me to share our family story with you today, and our daughter, Shannon, of Images by Kennedy, for preparing this beautiful slide presentation. Okay. So we start off with, again, I said, next slide. I love the bye-bye butts, right? So really we're talking about maternal smoking. Give you a brief little history, right? First of all, my wife is a nurse and an ex-smoker. Her mother was a nurse and a smoker. Her grandmother was a smoker, and 2 of her sisters are still smokers. The only sister which is not a smoker is her youngest sister, who was raised by us in a house of non-smokers. And my wife, who was still smoking, would smoke only outside. 2 of my wife's sisters were born premature. We're gonna find that's important. Her oldest sister was born 28 weeks, which is actually 3 months early, and she weighed only 3 pounds. Her youngest sister was born 32 weeks, which is 6 weeks early, and she weighed 4 pounds. My wife's mother died of premature death at age 50 of cardiac disease. Her father, an occasional cigarette smoker, died at 82. Our son is a smoker and our daughter is not. My parents were ex-smokers, and neither myself nor my 4 sisters are smokers, and both our parents died in their mid-80s. My wife finally stopped smoking after developing breast cancer and is currently celebrating her 13th year as a breast cancer survivor. So praise God, this is actually, again, I said, more personal to me because it involves not only my family, but extended family. So we start off, don't smoke, and the presentation is just beginning. Pretty much smoking maternal health is bad, period. Smoking increases the risk of premature births and related complications. The complications are numerous. We know that, again, I said 2 of my sister-in-laws were actually premature. So premature birth occurs if you're a smoker. Low birth weight, the 3 pounds, the 4 pounds, those are low birth weights. And also sudden infant death syndrome called SIDS, which we'll be seeing next, is where your kid may die in the crib from some unknown cause. Asthma, wheezing, obesity, and weight gain are all associated with actually mothers who smoke. Learning disabilities, behavioral problems. Babies have a thing called bronchopulmonary dysplasia, which basically is chronic lung disease in children. And so that happens, in fact, with your high risk for that if your mom, in fact, is a smoker. And also, last and most important almost of all these things, you're creating a trend that your offsprings may continue to smoke and have the same problems that you have. Next slide. Jay, next slide. So what does smoking do to your fetus? 2 little words, birth defects. There are multiple birth defects that happens when in fact you smoke. First, smoke occupies the hemoglobin, or the substance that carries oxygen. So your baby actually has shorter breath when they're inside you when you smoke. It affects their brain, their kidneys, their lung, and every other organ. And therefore they end up having malformations. They end up having birth defects. They occur in the heart, they occur in the muscle system, your bones, they occur in face, cleft palate, your lips may not form, facial deformities, your limbs may be deformed. You may have, like I said, anal atresia means you're born without a butt, but this is not B-U-T-T here, as our smoking is, right? Missing extra digits, cranial problems with your skull, gastrointestinal problems. All these are associated with actually birth defects that are associated with increase in smoking. Next slide. SID, sudden infant death syndrome. We know that like mothers who smoke during pregnancy, their kids are more likely to have this sudden infant death syndrome. And that's when your child within the first year, all of a sudden in crib, they call it crib death, dies with an unknown reason, we don't know why. We know that occurs more in males. We know it occurs more in babies which are premature. We know that if you're sleeping prone, which is on your belly, you have a greater chance, or sleeping in a soft bed increases your risk. But we also know that many people don't know that if you actually are a smoker during pregnancy, it almost doubles the risk of actually this occurring to you. So that's actually, the more you smoke, the higher the risk. And also if you have your baby sleeping with you in bed while you're smoking, you increase the risk. How can we reduce that? Breastfeeding. Actually, like I said, not smoking, of course, is an obvious one, using pacifiers. But the most important thing, don't smoke. The good news is that if you stop smoking during your pregnancy, it does make a difference. The sooner you stop, the better the effect. Next slide. Next slide. Okay. Smoking increases the risk of children developing asthma. Asthma is a disease that many times we think is a function that's actually genetic inherited. But if you smoke, your child have a chance of wheezing even though you have no history in your family of asthma. So it happens more to kids who are actually less than 6 years of age. If you smoke, they have a greater chance of actually wheezing. Kids who are over 6 actually have a greater chance of developing asthma. And if both parents smoke, their chances actually going to impact kids which are less than 6 years old, more so. Next slide. Smoking has neurological and causes problems in terms of learning disabilities. There's actually data support that actually it affects their IQ, intelligence. It has poor school performance, behavior problems. They have difficulty being they're easily distracted, and they may be development delayed. So smoking has some very bad things that happens. Next slide. Smoking, one of the things that I didn't know, which actually smoking increases the risk of having child be obese, increasing being overweight. So again, there are so many different things we're finding out about smoke. It just reinforces that it's not a good thing to have happen during pregnancy. Next slide. Now, secondhand smoke, thirdhand smoke. Secondhand smoke means that they're going to blow in your face. Thirdhand smokes, when you smell somebody who's actually been smoking, that's thirdhand. Thirdhand potentially can be even worse than secondhand because the smoke interacts with your clothes, which could be chemicals and cause chemical like release. We know that, again, children actually get more exposed to actually second and thirdhand smoke than adults, either men or women. So it means kids are particularly vulnerable. We also found that there's data supporting that a lot of pregnant women are actually, even if they don't smoke, they're exposed to secondhand smoke. So again, the things that we're working to try to stop smoking in different places are critical for patients, for individuals who actually are pregnant. Okay, next slide. So it's the hook. We now know that, like I said, again, mothers who smoke, the kids will be smokers. That's why I read you about my family's exposure, that in my wife's family, mom smoked and all her siblings smoked. Again, does it have to happen? No, it doesn't have to happen. But again, it tends to lead to, again, increased risk that your child will smoke, in fact, if you're a smoker, right? Next slide. Summary. Smoking, the sooner you stop, the better it is. The earlier you stop in pregnancy, the better it is. It helps to get counseling, peer support, and it also helps if, in fact, you have some type of incentive to stop, right? It seems to be less effective in terms of with the nicotine replacement therapies than actually having the big desire to stop. I love the sign, I love you for not smoking. That's really what we want to see. We want to see more smoking legislation that helps us stop smoking so we won't have second and third hand smoke. And we want to see parents actually become more aware and realize the dangers and risks associated with smoking. Next slide. The last little slide or last slide? Okay, just reinforcing. Let's all work together to stop smoking. Rather, we're pregnant, non-pregnant, let's stop smoking, because even if you're pregnant and you don't smoke, you don't want to be exposed to firsthand, secondhand, or third-hand smoke. So that's it, and thank you very much. It's been a pleasure. We're opening up to questions.
We are encouraging questions. Mr. Newman has been working in the hospital and dealing with lung functioning for, I want to say over 40 years at this point. So if you want to know the ins and ills of what happens with people who have had parents that have smoked, or people who smoke, or people who've been exposed to smoke potentially, please feel free to ask away. We have 15 minutes.
I guess I went too fast, huh?
I have a question. If a mother ceases smoking and then resumes smoking, is there any impact on the young child or the infant child?
Depends. We know that if you smoke, while you're actually pregnant, it has all those negative effects. We also know if you smoke after the baby's born, the baby gets secondhand smoke and still impacts them. So if you stop smoking, it's beneficial, but not only for you, for also the child. But you got to remember that one of those last slides, it said pretty much if in fact kids are around smokers, they tend to smoke. So even if in fact if they get secondhand smoke or third-hand smoke, they still tend to smoke themselves. But there's no rigid rules, but it just increases their chance that they will smoke. So that means it's going to have a lifelong impact on that child. Good question. Thank you. So while we're waiting, I'll just kind of cover one more thing. Many times in a hospital, we have parents who come in who actually smell so strong of smoke that it's difficult for us to try to really get them to visit their child. And we try to encourage them to wash and change their clothes, wear different things, but they'll come in smelling very hard and very strong in terms of smoke. We also challenge sometimes that we'll have any employees, which may be smokers. And I'd like to see us have more stringent rules and regulations to address that, but unfortunately, they haven't got there yet. We have employees who actually smell stronger and smoke than parents do, and we haven't had anything addressed and done with that in our hospital and maybe some other hospitals. So there's a need really for us to address the fact that third and secondhand smoke is impacting everyone.
So, Mr. Newman, I know that you might have some insight into this, because I know at one point you were supervising actually people in the cardio department, right? Did you hear frequently about like what happened to people who had a lot of blockages, who had like poor outcomes because they were smokers, opposed to what could have potentially happened if they had not been?
There's data to support the fact that really on the adult side, there's all kind of complications, because nicotine causes your blood vessel to constrict, it's caused migraine headaches, there's a bunch of things it does, increase your risk for heart disease. Again, the outcomes are poor on the adult side also. I focused on really just maternal, but you find smoking is bad across the board from adults to kids to everything else. And that's not even getting into right now the alternatives that we're talking about. Even though we legalize marijuana has a lot of the same constituents that does damage to your lung as smoke does. So again, we've actually moved into an area where we're actually maybe switching from tobacco, but we're switching to other devices. But those devices also have some similar complications associated with smoking. I think one of the first slides talked about there are somewhere around 4,000 different types of chemicals when you smoke. Well, again, you find out those chemicals may change a little bit when you're going from e-cigarettes to, again, like marijuana, but they're still going into your lungs. And your lungs not designed really to have those chemicals breathe into your lung. So.
I just might get in here and add, we just updated our smoking ordinance in Claremont. And the one thing we did do too is we redid the definition of smoking to include e-cigarettes and vaping and marijuana, smoking marijuana. And I think that we should encourage everybody to ask their legislatures to do that locally, not at the state level.
I think that's wonderful. And really, I think we just had a brief blurb, but there's definitely data that really emphasizes how important it is if you have legislation that actually encourages the stopping of smoking, because it makes a big difference in terms of not only with kids, adults, and everyone else. So great job, Mayor.
Yes. And you know, one of the things it's relevant to all of this with respect to legislation is having supportive elected officials. So I want to say for Mayor Schrader, he looked at the data, he recognized what was going on with respect to health risk and impact, and he really pushed also to make sure that, you know, people understood why it was significant to go ahead and expand the definition of smoke and smoking. And, you know, there's just a lot of information that we have to offer. We have a lot of resources. I don't know if anybody has any questions or will have any questions, but like I said, the floor is open and I'm really encouraging you all to get involved. This is supposed to be an interactive experience. Mr. Newman is an educator as well, but he does like people to ask him questions. So please, please ask away.
I think that one of the things we have to be careful of that right now is the age of fake news. There's a lot of actually, you know, news that are going to minimize the dangers and risks associated with different alternatives to smoking. I think you have to be very careful and realize that even though they may not be able to prove things, that those things probably are going to be dangerous and damaging to you. A good example is that probably about 10 years ago, we started giving infants less oxygen because we're worried about their eyes. Premature infants, if they're given too much oxygen, they become blinded. Stevie Wonder was one baby that was blind because too much oxygen. So then we started actually decreasing the amount of oxygen we're giving babies, and we found out 10 years later that those babies were having learning disability because we were saving their eyes, but we're damaging their brains. So sometimes you won't find out until years later that something is true. So what they may tell you today, hey, there's not enough data to support the fact smoking is bad for you in terms of different types of alternatives. But later on, you'll find out, maybe too late, that yes, that is also just as bad as smoking. Okay.
Anyone?
I have a question. Oh, did you have a question, Andrea?
No,
I did. I'll let Andrea go first so I can think about how to word mine because I wasn't quite sure how to word it, but I'll ask it after.
Wow, I was going to let you go first because I was going to go first. Mine. My question, though, is kind of centered around Black maternal health. Is there, because we know that the tobacco industry has systematically targeted Black and Brown communities for decades. Is there any data that sort of correlated or related to Black maternal health, sort of like death and secondhand smoke or thirdhand smoke? Is there any sort of data around that that you know of?
I don't. When I was doing this research, there are about 12,000 articles, right? I got through about 100 of them, all right? None of them related to Blacks, but we know that the mortality rate, which is death and morbidity is illness, that Black babies, even in Los Angeles, typically have about 3 times more problems than non-Blacks. And LA is actually probably a high level center. So if you're looking at someplace else, it's probably worse. So there was no data I came across, but just, yeah, minority kids tend to have more difficulty, period. Yeah.
Thank you.
Good question. Thank you.
Okay, so we all know that smoking is bad, right?
Yes.
So I guess my question is, why do you think that, is it because it's addictive that moms continue to smoke? And if so, is kind of like the scare tactic the way to go? Or like, do you think that providing education to women who aren't yet pregnant is helpful? Or what are some things that might be the best approach to try to prevent people from doing that to begin with?
I think there's no one approach that's going to work for everyone. So I think that what you have to do is find out for that individuals, What are some of the things that are important to them? What's they're vested into? One of the things I think is stressing education, to me always is helpful, because I think that knowledge is power. And so if you can give a person knowledge, that's a good beginning. But the other part is discipline. And that's harder. Many times, again, our young people don't have the knowledge about finances. And if they did, would have the discipline. But I think we need to, first of all, give them knowledge, and hopefully with the knowledge will come discipline. And I think you have to reinforce it. It's not something easy. I know I got very upset with my wife when I found her after she had been diagnosed with breast cancer. She was smoking, but you can't tell a person what to do. You can support them, you can do what you can, but you got to work with them to try to say, this is important. I know that all those parents that come visit their kids, even though they come with smoke, their kids are important. So first we try to educate, then reinforce why it's damaging their kids, and hope with time that they'll get the discipline to do it. So I think knowledge will begin discipline. And I think all those things that are supportive in terms of peer group and support's all important. But no one single thing's going to stop anyone. I think if they can reduce it, we know that it's dose related. So the more you smoke, the worse it is. So if you can get them to reduce their smoking, then that's a success, right? Because we know that in fact, if you have less than 10 cigarettes, you have better outcome if you're taking 20 cigarettes. So I think if we can't get them to stop, we can get them to reduce it. It's still better. Good question. Thank you. And you phrased it nicely.
Well, I suppose that no one else has any questions, but again, if you do happen to have any questions, please feel free to ask Mr. Newman. For those of you who are coming in, Mr. Newman is a respiratory care practitioner and also a neonatal specialist, and has over 40 years of experience in assisting people who have issues with their respiratory system. So please feel free to ask anything that maybe you haven't had the opportunity to ask a medical professional. Regarding smoking, or lung health, he would be glad to answer.
So Shay, also they always can actually send you messages that we can get back to them at a later date. So if something occurs to them later on to think about, ask them to really some kind of way contact you, and we can get back a response to them.
Okay, so what I will do is I will put my email in the chat, just in case anyone does have any questions for Mr. Newman that they would like relayed at any point in time, and he will get back to you. He is very good about that.
Yeah.
Well, thank you so much for your time, Mr. Newman. You are
My
completely appreciated, and we are glad to have had you. Wonderful presenter.
Okay, thank you for all the great questions. And Merritt, thank you for your support.
Absolutely.
Okay, well, next up, we actually have, we were scheduled to have a testimony provided in Spanish. Someone who has gone through the process of learning how to stop smoking. I am not sure that that person is here. If you are here, can you let me know, please? No? Okay, well, in that case, I'm going to introduce day one. Day one, we have Dominic, we have Alex, we have Alicia, and Alicia is the Tobacco Prevention Director. Alex is the Community Engagement Coordinator, and Dominic is actually the Project Coordinator. I have a little bit of information to share about them with you all. So, let's see. Well, actually, this is what they wanted you to know. Day one is a community-based nonprofit organization with a 30-year history of providing effective, high-quality, and culturally sensitive public health education, intervention, and policy development. Join Day one as they detail their experience working with the Pomona High School AVID class on a service learning project revolving around the issue of drifting secondhand smoke within multi-unit housing. Students will also chime in on their experience using photography and advocacy as tools for social change and community engagement. Welcome, day one. Who should I?
So it's been a pleasure, but I've got one more other appointment, okay? So
Okay.
take care. Bye-bye now.
Take care. Bye-bye.
Thank you.
Take care. Bye-bye. Yeah.
Who
Hey,
should
Shay,
I?
you can hand it over to me.
Okay.
Thank you. Go ahead and screen share.
Hi, everybody. This is Jose Guzman.
Oh, hi,
Hello.
Jose. Are you here to share your testimony?
Yes.
Oh, okay.
I just was in my supervision, but I'm over here.
Okay, well, thank you for being here. We are ready. We're listening.
Okay, you know, my name is Jose Luis Guzman. I came from Mexico City, and not exactly Mexico City, but Mexico. Anyway, I started using tobacco since I would say it in Spanish, you know, because supposed to
No,
be in
you
Spanish.
can. Please, you can.
Ok. Mi nombre es José Luis Guzmán. Yo vengo de México. Emigré aquí en 1990. Yo he estado usando tabaco, o paré de usarlo hace 4 años, pero desde que tenía 10 años. La accesibilidad al tabaco en México era relativamente muy fácil. Ya sea que le tomaba yo cigarros a mi papá o iba a la tienda, me compraba por 5 centavos un cigarro. Empezamos a fumar un cigarro al día, 2, 3, sucesivamente fue incrementando. La situación fue que culturalmente es aceptable que mucha gente fume hasta menores de edad. No es algo que lo vean mal. Mi abuela fumaba y me daba cigarros. Mi papá fumaba, me daba cigarros. No había una concientización de las personas en favor de dejar de fumar. O los daños que causaba posiblemente sabían, pero no estaban conscientes o no lo querían hacer. Yo pasé por diferentes situaciones estresantes. Yo cuando quería dejar de fumar paraba y usaba diferentes métodos, ya sea la goma de mascar o parches o diferentes situaciones. Me ponía a leer, a entretenerme de diferente manera. Pero había situaciones en mi vida que me causaban estrés y veía yo en el cigarro el refugio, la ayuda para poder estabilizar mi situación, vamos a decir, emocional en ese momento, y volví a caer en el hábito de fumar. If you want me to repeat this in English, I can do it, no problem. That's okay. You are muted. Okay.
If you'd like to, that would be great.
Okay. Yes. So what I was saying is that I started smoking at 10 years old, and it was easy for me to access cigarettes. And even though, you know, I stole from my dad, maybe my grandma gave me some cigarettes, and I used to go to the corner store and buy a cigarette. They sell loose cigarettes for 5 cents. And it was, you know, I started smoking one at the time in that day, and maybe, you know, 2, 3, and they were increasing. You know, what I say that they're getting up to the point that I used to smoke 1.5 package a day. And I tried to stop several times. I used different techniques, and sometimes I lasted like 6 months or 1 year. But something happened in my life and my family and everything, environmental life, and I had to look for a cigarette in order for me to minimize my emotional station on that time. So eso es lo que dije en español. Enseguida yo continuaba fumando y veía yo que pues mi salud se iba demeritando. Estoy yo no muy fortalecido de los pulmones porque he tenido recaídas de neumonía. Pero yo la razón que dejé de fumar fue porque después de 48 años dejé de fumar porque vi que eso, I realized, ¿no? Que eso le estaba haciendo daño no nada más a mí, sino a mi familia y financieramente, you know. So what I said is I've been smoking for 40 years before I stopped it, and that because my family situation, my health, I've been, with a pneumonia like 2 or 3 times, and it has been so bad for me. So I had to stop, and not just for the health, also for the family, and also for financially. Now the package of cigarettes costs almost $10. If you smoke 2 cigarettes a day, I mean, and 2 packages of cigarettes is $20 a day. Oh my gosh, it's too much. Multiply by, 30 days a month, because doesn't have stuff on the weekends. So you go straightforward. So, yeah, So lo que estoy diciendo también es de que paré de fumar por varias situaciones, y una de ellas también financieramente, porque los paquetes de cigarro cuestan $10. $10, y si fumo uno y medio, son 10, $15, multiplicado por 30, multiplicado por 365, ya me hubiera comprado un carro nuevo. Y realmente fue lo que pasó. Yo me puse y me dije, gasto tanto en cigarros, me puedo comprar un carro, y lo que yo gasto de cigarros lo pongo para el pago del carro. Eso fue mi recompensa en cierta manera, independientemente de la recompensa de salud. So, me benefició mucho por todos lados el haber dejado de fumar. Y hasta este punto, a veces me dan ganas, pero yo me detengo, No me molesta el humo del cigarro, como mucha gente dice, ay, me da asco, a mí no, me gusta, y si alguien está fumando está bien, yo no me pongo, pero no voy a comprar una cajetilla de cigarros y empezar a fumar otra vez. Yo lo que le digo a mucha gente cuando está tratando de parar de fumar es alejarse de las personas que fuman, evitar los estreses que tenemos en la vida. Es difícil porque independientemente de todo eso, yo he tenido varias situaciones muy estresantes, pero gracias al apoyo de mi familia, he podido sobrepasarlas. De alguna o de otra manera me apoyan, y el estar, vamos a decir, no tan cerca de personas que fuman, eso también ha ayudado. So what I said I share that it has been, hard for me because 4 years I haven't been smoking, and I've been, in some situations that sometimes I wanted, but thanks to my family support and not be around people who smokes, that been helping me. So be aware of the situations that has been causing to my health too. So I feel so good after 4 years stopping smoking, and I guess, I already paid off my car, so I'm happy. So that's a good outcomes, So yeah.
Well, thank you so much, Jose. So something that you had said that caught my ear when you were speaking in Spanish was that it's culturally acceptable. Like it was something that your family did. Your mother did it. I heard you say your abuela did it. Like it was a thing.
Yeah.
So what would you say to people who have that impact, like that influence in their life? What would you encourage them to do?
It is hard, to say something to someone that is not accepting that is bad for their health. They just see this like a normal thing. They're normalized. The people, what I've been hearing is I say, I would die from something. So, mine is what, I can die from the smoking. Maybe I go out and the car can, hit me and I would die, or I can have a heart attack. That's another thing. But no, what I would say is that, it is good for you to start for your family. We have to start there because it's a chain, you smoke, your son smoke, and so on. But I break the link. No one of my children smokes. My wife doesn't smoke. So that's the thing that I feel rewarding having that position. So, lo voy a decir en español, para la gente que como yo culturalmente es aceptable que fumemos, y más nos apoyan nuestros papás, me apoya mi abuela, me daba cigarros mi abuela. So, para mí no era una cosa mala de estar fumando, independientemente fumábamos en los camiones, fumábamos en todos lados. Pero la situación es que la gente debe de estar consciente en qué formas están afectando su vida. Mucha gente no entiende y piensa y dice que de todos modos me voy a morir. Si no me muero de fumar, me muero de un ataque al corazón, me atropella un carro, me puedo morir de cualquier forma. Yo lo que les recomiendo es que consideren y valoren más lo que tienen como su familia y su salud. ¿Ya? Eso para mí es lo más importante.
Yes, very, very important. Thank you so much for that, Jose, for sharing such a beautiful testimony and encouragement to people who may be going through, trying to stop smoking. And congratulations on where you.
Thank you. And we are still on the risk, who knows? But I mean, my point is, I want to be mind-centered and, not smoke.
Yes.
You don't know. I mean, I say it like the alcoholic always is alcoholic. I would say I continue being a smoker because we share the environment, and the environment sometimes has more pollution than the smoking.
Right.
So that's, but be positive, make sure that, you communicate with the family and tell them you see me trying to smoke or whatever, just approach me in a different way. Because sometimes they say, why are you doing that, but in a different way, and it's ways to encourage people to not doing things, not treating them or judging them.
Right. So true. Does anyone have any questions for Mr. Guzman? In English or in Espanol?
Yeah.
I may have missed it, Mr. Guzman, but did you use any nicotine replacement therapy or did you just quit cold turkey?
Well, in the last one, I just quit. But I stated in the beginning that I've been using, some kind of gum or patch, that they have a patch here, but that didn't work. What's worsened because I used the patch and I still smoking. So the patch is not doing, so I got an overdose of nicotine. So that's the problem when we are not cautious. We think that those are magic things, like a magic pill, the next day pill, and that's it, se acabó. Pero no es algo que le induce uno más la nicotina, porque no está uno consciente de que el parche lo que está haciendo es metiendo la nicotina lentamente y continuamente, y traes el parche todo el día y tú sigues fumando, entonces lo que te mete aquí, lo que te metes acá, es el doble.
Too much. It is.
You're double-shooting yourself. Yeah.
Yeah.
So it is, and it's wasting money because that's so expensive, those things. Some insurance they pay for, but I didn't have insurance sometimes with the time that I try. And you pay like $60 for a chewing gum, and I didn't see much benefit for that. I was maybe not psychologically prepared. That's another thing. Tenemos que estar nosotros también psicológicamente preparados para eso, porque la goma de mascar y los parches no son mágicos. Si no está con la ayuda, tenemos que formarnos, vamos a decir, un grupo de apoyo. Pero yo nunca tuve un grupo de apoyo. Todos mis amigos fumaban, mis hermanos fumaban, mi papá fumaba. No había dónde esconderse para dejar de fumar. Y la presión también de los amigos, fúmate un cigarro, es que no eres hombre o qué, Pero es difícil, pero ciertamente sí usé varias cosas para dejar de fumar.
Right. Well, thank you again so much, Mr. Guzman. We are going to get back into day one. I know I had kind of introduced you all. I am so glad to have everyone here. No, please feel free to stay.
No, thank you so much for inviting me to do this.
No, thank you so much.
Appreciate it.
You are appreciated and valued. So thank you. Thank you very much.
Thank you.
So I think, Dominic, that I gave you. Okay.
Thank you. Thank you, Mr. Guzman. That was a great little anecdote there. Appreciate that. I'm gonna go ahead and start our presentation. Let's see, screen one. Cool. And Alicia's gonna go ahead and start us off.
Okay, so good afternoon, everyone. As Shay mentioned, Day One has been around for over 30 years, working on culturally competent public health and public policy programs in the San Gabriel Valley. Our main office is in Pasadena, but we have expanded to having an office in El Monte and also Pomona. And just a side note, we do involve young people, youth, in all of the work that we do. And many of our staff were actually youth advocates in the past, and they went on to college and they came back as staff. So we're really grateful to have them and their experience working with us throughout the years. And so just a quick history of our efforts in Pomona. We've been working on public health and public policy issues for the past 8 years, looking at things like marijuana and alcohol prevention, as well as tobacco prevention, which is the department that myself, Dominic, and Alex work under. And we actually helped Pomona bring smoke-free parks back in 2015. So that was a great success. We've had really great partners, including NCADD and Prototypes and other organizations in the city. So that was really wonderful. We also did some work on reducing youth access to tobacco products. And that brings us to our current work, which we are focusing on reducing secondhand smoke in multi-unit housing. So we have collected some data over the past year to see if the city and the community is ready to look at the issue and possibly adopt a policy that restricts smoking in apartments and condos throughout the city. So we did some work with some youth on this project. So I will hand it over to Dom and Alex, and they will tell you more about the project.
Thanks, Alicia. That was a good intro, good start. So yeah, as Alicia had mentioned, we worked on a service learning project. And I want to talk a little bit about how we kind of got to that stage. So originally we were invited out to present to this faculty, the entire faculty at Pomona High School. This was a big opportunity for the team, and we were excited to do so. So we went out there, we had our presentation, it went very smoothly. Alex and I, we were outside kind of just, debriefing about the presentation, giving each other high fives basically. And then a teacher came up to us, and she was actually, her name's Miss Morales Vargas. She's an avid teacher. She reached out to us and she said, "Hey, I really liked your presentation. I'm a high school teacher, and I'm seeing this issue with vaping and smoking with my youth, and I'm hearing about it a lot. Is there something we can do, like a collaboration of sorts?" So we said, yeah. So we said, first steps first, let's go ahead and go to your class. We can present on the issue just to see if there's interest, maybe do a little bit of educating for the students. So we went out to our classroom, we presented to the students. And we heard some feedback about them having issues with smoking. A lot of them lived in apartments, multi-unit housing of sorts. So there was some feedback and some anecdotes that they provided to us. So we thought this would be a great opportunity to work with these students. So basically the AVID teacher incorporated this smoke-free multi-unit housing kind of efforts into their service learning project, which is a requirement of their AVID class. So it kind of worked out perfect, and we were both able to kind of benefit in a way from each other. So we worked with the students on developing a photo voice project. And this is, I will say this was my first time working on a service learning project with students. I was a part of the service learning project in college, so I was excited to be on the other side of it, kind of, working with some students. And we're gonna talk a little bit about what a photo voice is. If you're not familiar with a photo voice, it's a type of participatory research methodology designed to empower participants through photography and the power of storytelling in small group settings. So there's a lot of benefits. Mostly it's low cost, easy, and effective. It doesn't cost very much to do a photo voice. A lot of students have access to cell phones or cameras of some sorts to kind of fulfill the photo part of the photo voice. It documents and reflects reality. This is like a legitimate data collection tool that's used. It introduces new insights and perspectives. So these students are the experts in their communities. So we really wanted to give them the tools to be able to kind of, take a snapshot of their community and really provide a caption or a commentary on the communities. It raises awareness and gives members a voice over issues affecting their lives, and it empowers members to influence policy. The assignment. So seeing that this was like based in, it was very academic. We wanted to make the assignment seem like it was just like we created it, like it was something that the teacher would, give to her students usually. So basically our assignment outlined what the project would be about, how the students' work would be showcased, and what would be expected from the student. The assignments can be easily tailored to fit any curriculum, subject, or project. So this is something that, you know, you can work with college students, you can work with younger ones. It's something that's easily tailorable. And it's designed to be easy on the teachers and students, which is important because we've been getting a lot of feedback from teachers saying that, you know, their workloads have been insane, working from home and having all these students to manage, and, you know, there's just a lot going on. So we wanted to make it easy on the teacher. As you can see here, there's a bit of an overview. We wanted two major components to our photo voice project. There was a data collection portion, which is the photo voice, and the community engagement portion, because we figured, you know, if you have data, you want to be able to not just have that exist in a vacuum. You want to see how can you get this data out? How can you engage with the community? So the data collection is pretty straightforward. It's the photo voice, the photo, and then the caption. The community engagement. So originally we had two events planned for students. One was for them to table at their school at Pomona High School during a lunch period, where kind of students are going in and out. And then the second one would be to host like maybe something in downtown Pomona. It would be like an art gallery perhaps, or some sort of community space where they can have, you know, easels with their photo voice projects shown, and maybe invite some council members out, community members, family and friends. We were able to do the first event, which was the tabling at the high school lunch period. We were not able to do the second event because this was late February. We're planning for, you know, late March to do this event, and as everyone knows, that's right around the time when kind of work from home started, and everybody was just kind of sheltered in.
All right, and then I can take on from here. Hi everyone, my name is Alex, and I'm the community engagement coordinator. Thank you all for joining. So I just want to give a little more background information on kind of the process we went through. Because a large component of our work deals with working with youth, we have to obtain consent forms from the youth, so from their parents or their legal guardians. So this is an example of the consent form we used for this particular project. It outlines what the project was about, how the students' work will be showcased, and what is expected from the student. Also, just a little tip, when we do publish like youth's work, we usually just put their name and supplement their last name with like their age or the school that they come from, just for, you know, privacy and proprietary reasons, and also because they're minors. So like Dominic mentioned, we actually had a different thing in mind for presenting this project. So we end up doing more of a kind of online, turning it into a blog. So we wanted students to get creative with their photos. At first we were thinking about ways to kind of like structure it, because we didn't want it kind of tearing from the main subject. But we felt that giving them the more, you know, freedom, they were able to be more creative. See, the first photo seemed staged, but we thought it was pretty poignant and showing how like innocuous a cigarette can be infiltrating a student's kind of everyday life. The other photo, students messing with like angles to kind of just showcase tobacco litter, or from like a Swisher blunt. And the other photo is like a triptych. So a student kind of just wanted to stitch together 3 images together to kind of showcase one main topic. So that's kind of, we're going to go more into, we're going to show you the blog in itself, but just want to give you a showcase of kind of how the students were creative. So this is kind of the screenshots of our blog, but we're going to go into the website just to kind of show you the landing page and the subsequent pages as well. Did you have that page ready, Dom?
Are you able to see that?
Yeah.
Okay.
Okay, so this is our landing page. We kind of set it up for the students. We asked them to send us their information, their photo voices, their images, their narratives, and we just populated ourselves. So it's kind of in a streamlined way. Right in the beginning, we had the event prior to the whole COVID situation, where students tabled with their peers. So we kind of just have a slideshow of the images we took of that event. So you can kind of just peruse through there.
That was a really fun event, by the way. That was the highlight for me of the year.
They did really well, really proud of them. I kind of put them in our own shoes, you know. This is kind of the work we do when we talk to the community, and they were able to get a taste of it, and that was pretty awesome. Then when you scroll down, we talk more about the issue at hand, just so that people who enter the page know what this is all about, and the action we took. So working with the students, we actually shared the resources that we shared with the students as well, so that everyone's kind of on the same page and they have all that same information. This is some of the data collection that we did with surveys. So that's very important. And then we can go to the blog section. So this is kind of the meat and potatoes of the website. This is a lot of the, pretty much the students who submitted consent forms, we were able to showcase their work and their images. So you can just kind of scroll down. It's pretty nice. You can see that they kind of tried to encapsulate as much as they can about smoke-free multi-unit housing in an image. So they took pictures around their apartment complexes, the litter that they saw and stuff like that. Then we have our About Me page that talks a little bit about the coalition that we are, that we facilitate. We have the Youth Coalition and the Adult Coalition, but they all have the same purpose of, addressing the issue of drifting secondhand smoke in multi-unit housing. This is our contact page. We have our little ad that we sometimes publish in local newspapers so that residents who are experiencing this issue can contact us. And yeah, that's pretty much the website in a nutshell. I want to introduce.
Oh, go ahead.
Oh, sorry.
Go ahead.
I want to introduce our student, Annika. She's able to come here and talk about her experience. So, Annika, if you want to hop on.
Hello, my name is Annika Cardenas. I am an avid senior at Pomona High School. This service learning project was really an amazing experience. The research that we conducted, we did it through reading articles, by just researching, and it was really something that brought awareness to me. It wasn't something that I really looked at because I do live in a home, but through the surveys that we were able to conduct, I realized that I may not be in a multi-unit housing, but my family is, my nephews are, and that's what really drove me to it. I was like, whoa, like something that I never really paid attention to is something that is really important, and it can make a very powerful impact on the community if we're just able to bring more awareness to our community. The tabling, the community engagement, as I said, it was really fun. It was interesting to be able to share my perspective to other people. And it was also interesting for them to share their perspective with me as well on how they are also dealing with it. It's not just something that some of us deal with. It is something that we all deal with as a community. The Photo Voice project was also a very creative way to bring all our research together. I actually captured a photo of a liquor store, and outside of it, there's brands of the cigarettes and things like that. And what's not captured in the picture is that this liquor store is surrounded by apartments, by several apartments. So I was like, okay, my nephews, the kids that I love, my close ones, are dealing with this, but imagine the other people, their children, the older people, everybody is dealing with it, because it's really easy for somebody just to walk out and open a pack and then start smoking. So it is something that just really drew this whole service learning project really drew me into it, because I was like, this is a serious issue and this is something that needs to be discussed more, which I'm glad that we were able to do.
Thank you so much. And then, so talking about community engagement beyond the classroom. So since we were able to turn into a blog, it was very nice to kind of digitize the work that the students did. One way we can let the community know about this is through emails, through meetings, and through presentations such as this. We asked participants that if they're interested in this topic or that they might know people who are, to share this with family and friends. And eventually, we're hoping that if this topic comes to fruition, like in city council meetings and such, that we can share this tool with decision makers. So that's pretty much how we want to engage beyond the classroom. I want to talk about the challenges we had with this project. We didn't receive all the consent forms from all the students who participated, And we lost some engagement with students who weren't personally affected by these issues. But some of the solutions that we used to circumvent that was to offer incentives for participation. So we would, give gift cards for students who completed everything, also extra credit for attending meetings. And also we provided samples to kind of help students see what how their project should look like. But yeah, that's kind of pretty much was the project. And I'll pass it on to Annika to kind of just explain how she plans to move forward after having done this project.
Okay, so now we are looking ahead. This service learning project does not only benefit us for now, but it is something that we could take with us to our future, such as college applications. It is a great way to be able to show that we were engaged with our community through the admission essays, with the personal statements, by having that extracurricular experience. I know that I definitely put work into this, so this is something that we can definitely showcase on our applications. Great way to show in our career for future career opportunities, such as resumes, applying for jobs, internships, volunteer opportunities, because we already have that experience being able to engage with the community, being able to know how to research, how to take surveys. This is something that we already have gained and acquired skills so that we can be able to apply this in the real world. And then it's a great way to bring awareness to communities. Not only can we educate other families, but we can educate our families. It's a great way to present to our community and to continue promoting awareness about the situation.
Cool. Thank you very much, Annika. I appreciate you being involved today and helping us out with this presentation. That was great. Here's our contact information. If you want to reach out to us, after our presentation, feel free to do so. It's just our first names at goday1.org. I know we don't have a lot of time left, but if anyone has any burning questions, we're here to answer them. I would say that if you have the opportunity, if you have like students, that you're working with, I know a lot of us are involved with like youth coalitions and stuff. Doing a service learning project is a great way to get them to be involved and really take ownership of creating something and being a part of, this kind of social change. So I highly recommended it. It was like maybe a little under a year-long process. It was a lot of planning involved, a lot of meetings. There's a lot of work, but the payoff was great at the end. I think, a lot of us benefited from it. So awesome experience overall.
I want to encourage everyone to ask questions. I know that, working with the youth can be a very different experience if you're only accustomed to working with adults. So I think that Dominic and Alex and Alicia can offer you a wealth of information as to maybe how to, I don't want to say pull youth in, but pull youth into really getting involved in the process and, learning the significance of really being a part of something of this magnitude for, their communities. Anyone? Well, Angie?
I know that y'all have a presentation at 2, but I have a quick question, and we can probably set up a one-on-one or something, but how did y'all advertise this? I'm not sure if I missed it in the presentation, if you covered it.
As far as like advertising to get students involved in it, or like after when it was completed?
I was wondering about the former, but if you'd like to share both, that would be cool too.
Oh, okay. Yeah, so we didn't really advertise it since we, as collaboration between the AVID teacher, she already had her cohort of students already. I think it was about 2 classes, each had maybe like 15 to 20 students. So it was a good amount, so we didn't really have the need to advertise it. But that may be something that, we have to do if we do this again, for sure. Something to consider. And the latter, how do we advertise after? Yeah, just social media. We have council members who like share it, like it, and are their friends and family who are sharing it and liking it. So really good way to get it out there. Thank you for the question.
Thank you. If anyone else,
Oh
no, please.
Oh, okay. I was like, is my mic not working again? Because it's been having problems. But thank you for your efforts in Pomona, Day One. I live in Pomona, so like Annika said, I mean, I don't live in multi-unit housing, but I'm pretty sure we all know someone that lives in multi-unit housing. So this is super important for everyone to have a smoke-free place. And then I didn't know that you all brought smoke-free parks, so thank you for that too.
Yes, thank you. A huge thank you. Anyone else? Like I said, I'm encouraging questions. I am the next presenter, so I am not rushing anyone. Feel free to ask away. No? Okay. Well, Day One, would you mind putting your information in the chat? Just your emails, if you're comfortable with doing that, so that if anyone who maybe was a little bit reluctant to speak publicly, you know, has anything to say, they will do so via email.
Thanks, Shay. Appreciate
Thank you
it.
all.
Thank you, everyone.
No, thank you all. And I don't believe I said this to you, but we will be sharing this on our Instagram and our Facebooks. And because we really want people to, you know, to get this information. And I do have actually one question to go, because I've had to ask everyone this question. How would you encourage someone, or what would you say to encourage someone to stop smoking? This is Bye Bye Butts Day. We want to keep the spirit of that, and we want to make sure that we are offering that support. That's open to any of you.
I would say I have done a bit of smoking cessation facilitation over the years. It's been a while, but I would say one of the biggest pieces of advice I give to people is to find your reasons why you want to quit. It is one of the most difficult things, and it takes most people up to 15 times before they actually quit. So I would say, like Mr. I think it's Garcia, did I get that right? Was speaking about before, or Guzman. Guzman. He said his family really was the reason why he quit. So I think when you're there, when you're really psychologically there wanting to quit, having 1 to 5 reasons even as to why really helps to keep you pushing and trying to avoid those cravings and getting through it.
Awesome. Thank you so much for that, Alicia. You all again have really encouraged us. You have reminded us of the significance of the youth in a different way than Mr. Newman did, because of course, you know, he was focusing on maternal health, but you all have discussed what happens with the older youth or the adolescents, and you know, they are important, and you know, their contribution is really important. So thank you all again for what you've done.
No problem. Special shout out to Annika too for joining us today.
Yes, thank you so much, Annika. Oh, look, I was going to say, did you leave? No, she's not gone. Good. Thank you so much. We really appreciate you coming and sharing your experience and your input.
Thank you for having me. It was a really cool experience.
Awesome. Yes, we're so glad to hear that. And so my presentation is actually going to be very brief, only because I don't want to go over too much what everyone else goes over. And, you know, we wanted to be careful to ensure that there was no overlap. So I hear someone, but I don't know where it's coming from. Okay, well.
Might be Lauren. I think she's off mute.
Oh yeah. Thank you. I'm seeing all of these mute buttons and I don't want to mess with anyone's. Okay. So I'm going to share my screen. So we are so glad to be a part of Bye Bye Butts Day. I'm going to be discussing secondhand smoke. My name is Shay Green, and I'm the project coordinator for outdoor areas at the National Council on Alcoholism and Drug Dependence. I am so glad to have all of you here with us today, and all of you who watch after this day or later on today. Thank you so much for taking the time out to watch and hear all of our wonderful presenters. I am the host, but I am also now a presenter. So I'm taking my hosting hat off and giving that to Andrea. No, okay, Andrea says no, thank you. I guess I'll keep my hosting hat on and I will keep my presenter hat on. So who is the National Council on Alcoholism and Drug Dependence, and what do we do? We offer counseling and outpatient services, including drug testing. We assist people who have had DUIs, and we have DUI and domestic violence programs. We deal with prevention. So we have a multi-unit housing, we have a youth-centered group, CPS, and we also have, let's see, outdoor areas, of course, and we focus on the exposure to secondhand smoke and secondhand aerosols. And then we also have people, again, who are dealing with drug use prevention with youth, and building a sustainable and trusted relationship with all of our communities is really significant to us. So secondhand smoke, what is it exactly? It is smoke that comes from the lit end of any tobacco or marijuana burning product or aerosol from any electronic smoking devices. And I just kind of wanted to give a brief timeline here. So in the 1600s, they discovered that there were issues potentially, I'm sorry, not the 1600s, 1960s, forgive me. 1960s, they discovered that there were issues with tobacco and exposure. And unfortunately, they were not really able to move on it. And so that was making an association between persons who lived with smokers and increased incidence of lung cancer. So they knew there was some sort of relationship, but they didn't know what it was. So they did not say too much. They just kind of let people go on being exposed to secondhand smoke without discouraging it completely. But in 1986, they conducted 13 studies, which included the observation of outcomes with spouses who lived with other spouses that smoked. And of the 13 studies, 11 had proven that there was a positive association between health outcomes and impacts and smoking exposure or secondhand smoke exposure. So in the 1990s, secondhand smoke and many of its harms had become pretty obvious. They, noticed that a lot of people were becoming ill who said they didn't smoke, and they were all ending up with very similar health issues. We're talking about lung cancer, stroke, cardiopulmonary issues, and things of that nature. And they said, okay, well, we know that there's something going on here. And at that point, they said, we really need to push to not only deal with intervention, but we also need to push for prevention. And so, prevention became a very significant part of the public health community's efforts to help educate people on the dangers of secondhand smoke. And today, there are a number of programs such as NCADD's programs, Day One program, the American Lung Association's programs, and a number of other agencies where we are trying to really prevent further involuntary exposure to secondhand smoke, and trying to, more so than anything, educate people so that they know what to do to make these changes. So I'm just very briefly going to touch on some of the health impacts. So we know that around 49,000 non-smokers die per year, which is really unfortunate because, again, these are people who are involuntarily exposed to the emissions of the different products that are released as a result of people who are smoking around them. Or byproducts, I should say. So there is no risk-free level of exposure to secondhand smoke. I know that some people are not aware of that because they figure, well, it's just a little bit of smoke. It's just gonna kind of walk past me and I'll never have to deal with it again. But they had found in one study that within 5 minutes of exposure, there was a change in the body. So you figure it doesn't take much. It's just a slight exposure that's required. So there is no risk-free level of exposure to secondhand smoke. And non-smoking adults, secondhand smoke can cause heart disease, it can cause stroke, and cause lung disease. In children, middle ear disease, respiratory infections, lower respiratory illnesses, sudden infant death syndrome, and with adults and also, well, with anyone, we see nasal irritation, we see respiratory irritation, and with adults, we've seen coronary heart disease, which is a big thing because I feel like a lot of us, when we hear coronary heart disease, we think bad diets. And some of us do have bad diets, that's true. But that is not what's going on in some cases. It's okay, you all can laugh at me. I'm happy with that. I want to say this is so very serious. So there's a mental health impact that is really not, I don't think that it's highly discussed, and I don't know if it's because more people are focused on the more immediate health impacts, but according to studies that have been conducted by a number of medical professionals, and we're talking about from the Archives of Pediatric and Adolescent Medicine to the University College of London, and a number of other physicians in other countries, so this is global. There is a relationship between secondhand smoke and a negative impact on mental health. So some of the mental health challenges that were noted and outcomes associated with secondhand smoke among various populations included an association with psychological distress, increased risk in psychiatric illness in healthy persons, and higher frequency of mental disorder. And again, this is not someone who's smoking, these are just people who are exposed to secondhand smoke. So some of the mental health implications found in adolescents in particular included major depressive disorder, generalized anxiety disorder, attention deficit and hyperactivity disorder. And I don't know if that, kind of rings a bell with respect to what's going on in our society right now, but we see with vaping, a lot of our youth really going through a lot of these things, dealing with major depressive disorder or anxiety disorders, and having issues with ADD or ADHD. And I don't think that anyone has drawn, or not that anyone, but that many have drawn the conclusion that a lot of this has to do with what we're being exposed to in our environment. So it is really critical that, we start moving towards making changes so that we can reduce this exposure and impact. So I'm actually going to take this down. But I was wondering if anyone had any questions about secondhand smoke or anything that they wanted to know. No? Okay. Well, I suppose I would like to just open up the floor for discussion then. How do you feel about secondhand smoke? What do you think is our greatest in, really encouraging and influencing people to stop smoking? Because again, this is really about encouraging people to reduce smoke themselves. We have to really look at the correlations here. If we get more people feeling comfortable enough in the support that they need to stop smoking, we have fewer issues with secondhand smoke. It's an obvious, direct correlation because it's just one of those things. So one of the reasons I find Bye Bye Butt Stay to be really significant is that, and is also because I don't think that people realize the depth of support that they have in the community. And I think a lot of people feel stigmatized when you say, oh, we're gonna, host something to help you if you, want to stop smoking, or to direct you to maybe a smoking cessation program. But I really want to break that stigma and, kind of take it in a different direction. And for the people who are more interested in policy, yes, there are policy solutions, and I can touch on those if you'd like. But I really want to focus on the people who want to stop smoking and the people who want to help people stop smoking. Yes, yes. I see that you're unmuted, Mr. Mayor.
Hi, I'm Larry. I think one of the biggest things about stopping to smoke is the health and safety of others, your family, and others around. And I think when that's mentioned, I started smoking in high school and I quit after my wife asked me, or my fiance at the time, 48 years ago, if I would stop smoking when we got married. And I said I would. And I think, you know, the older you get, the more you get. I have 7 grandchildren now, and I would hate to see anybody smoke around them. And I would encourage anybody smoking to be aware of the health of their family and people around them. I think that rings a bell with people. And especially if it comes from another family member. The other thing, and culturally, I think in every culture, you kind of build up this, if your family smokes, you smoke. My family's a long line of drinkers and smokers. And, you know, it's just part of our whole family way. The other thing, and the gentleman was speaking earlier was speaking of is dollars. It adds up really fast. I mean, I was looking up on the internet, and you know, it was saying it's like $6.25 a pack. He was saying it's $10 a pack. And if you smoke even a pack a day, that adds up quite a bit in a month, in a year, and in 10 years, you could pay for a small car, you know. So it really does. There's a big cost to it. And I think that's something people should realize. The other cost is the cost of what we pay in healthcare, because people who get sick, and there's a cost to that too. I'm a former finance director, and I've always been kind of the guy that's interested in the numbers and the dollars and cents. So I always bring that up. But it really is true. You know, there's a big cost to these things, and I think it would be nice. And as my wife say, it was just it's just a matter of being kind to each other and socially responsible. You know, I think that's with everything. If we were just socially responsible about this, it's the same way with wearing masks to fight the COVID. You know, we all have a social responsibility to members of society we live in to protect their health and safety. And if we just all did that, we'd be much better off. Okay, I'll get up my soapbox now, but thank you, Shay.
Thank you, Larry. That was wisdom speaking. I mean, you know, you just heard from someone who once smoked and who no longer smokes, and their perspective, that's really significant. So I would say one of the things I've pushed this, and I know that this is not necessarily what my agency has encouraged or discouraged anyone from pushing, but I always want everyone to consider the fact that nicotine is addictive. A lot of the people who smoke want to stop smoking and they cannot because they just don't know how. And so it's really important. I always tell my team, it's really important to me that we let everybody know we're not trying to vilify or stigmatize anyone. We're not trying to shame anyone or make anyone feel poorly or badly because they are suffering from addiction. And so I wanted to note that again, because, you know, mental health is a real thing. Anxiety is a real thing, and addiction is a real thing. And, you know, we want to provide a very supportive environment for people who are perhaps dealing with those struggles. And we want to let them know that, you know, again, we are vilifying the product, not the person. We are trying to get the product out, not the people. You know, when I was growing up, I was told that you have to separate well, this is just what I was told by an older member of my family, and maybe it'll resonate with you, maybe it will not, but you have to separate the sin from the person. And so what that really means is, you know, you have to take away the negative perception that you have of a person from who the person is, because a lot of times they're dealing with an underlying stress or challenge. And so it's just really, like I said, important to me as an individual, as a human being, to make sure that we let people know that we're here for them. And maybe, you know, we don't agree with lifestyle choices, but we do agree with giving them the support that they need to find the assistance that they need to change the things that they would like to change. So that is actually the end of my presentation, but the floor is open because we are waiting for, let's see, are my presenters here? from Tri-City? I don't believe they are. Well, I guess we'll give them a few minutes. We have more presenters coming from Tri-City Mental Health. Oh, yes, Angie.
I was thinking about what you were talking about in regards to mental health. It's kind of a two-way street, huh? It's
Yeah.
not just like, oh, if you smoke, you're more likely to develop mental health issues.
Right.
I think a lot of people with mental health issues are more likely to smoke. And it's just really crazy to think about all of those things and how they interact and the intersectionalities of everything. But that's really all I had to share. So thank you for listening.
Thank you, Angie. No, it's very true, very accurate. You know, the unfortunate thing about what we do is that there is a never-ending process and experience, because there are people who, even if we stop them from smoking outdoors or we stop them from smoking in homes, they're still the smoke, right? And so the issue and trauma that led them to smoking is still present, and the exposure for those of us who don't smoke is still present. And I think really collaborating with various communities and figuring out how to address that is probably going to be key in our ultimate success. But that's my only input, and I thank all of you. So I'm going to look at the schedule here and see who's supposed to be. Yes, it is supposed to be Tri-City. And we are waiting. Let's see. We are waiting for Martina.
Hi, it's Martina.
Hi, Martina.
Hi. Do you think you can make me a co-host, please? Because I have PowerPoint.
Absolutely.
Thank you.
Thank you for joining us today, Martina.
Yes, thank you. And I will be right with you. I'm just getting a little bit of information real quick, okay?
Take your time. Take your time.
Thank you.
So the floor is open. As I said, I'm encouraging people to speak your mind, tell us what you think. You know, we're here. I'm here. I'm a great ear.
It is kind of silly in a lot of ways. There was a comedian a long time ago that none of you will remember, Bob Newhart, who used to do telephone calls, and he did bits, and he pretended to be someone in the new land, America, dialing back to England, trying to describe this new thing he found, that the natives were drying out leaves, rolling them up on a piece of paper, putting them in their mouth and setting fire to them. And the person in England couldn't quite understand that. And when you put it in that perspective, I still can't quite understand that we roll up some dead weeds, put them in paper and light fire to them while they're in their mouth. So it's kind of the silly image.
It is.
I brought a smile to your face, Shay.
Thank you. No, you know, I feel like it's important that we not take ourselves overly serious. And I don't want to be too serious. I know this is a serious matter, but you know, laughter heals the heart. Yeah, I truly do believe that that is the case. If you go and you sit with someone who is typically not an excitable person and you smile, they usually still can't help but to smile. And it's because, you know, it's important. We were given smiles for a reason. So I am always glad to see everyone smiling, even though I also have an appreciation for serious moments. I do value, because at some point the way that I see life is that, you know, we only have what we left here, period. We only have what we left here. So if you never smile, if you never leave anyone with any joy, if you never leave anyone with any encouragement, you never leave anyone with any thoughts, you know, to improve themselves or their futures, what are you truly leaving? And for those
You
who
get after your local legislators, because Shay and I were after this non-smoking ordinance, and we took a chance, and it didn't pass 100%. It was a 5-1 vote, or 4-1 vote out of 5 members, and but it passed. Yes. So in most cities, you have 5 council members, and all you need is 3, and you get a smoking ordinance passed. So we did better than 3.
Yes. I'm so thankful to the whole team, everyone who worked on that, because we had a lot of people pulling with us and pushing. Good. And but Mara, you know, you did so much.
Well, so we did. Yeah, we did. It was a great thing, because it was one of those compromises where everybody left a little disappointed. Most of the people who didn't want smoking wanted the whole city, and we couldn't go quite that far, and the people that were against it were really against it. And so everybody went away a little disappointed, but we made progress.
Yes, we did. But hopefully everyone caught what he said. Go after your legislation. Go. Oh, are you ready, Martina?
I'm ready. Thank you very much. Sorry about the delay. Okay, so my name is Martina. I am a substance abuse counselor here at Tri-City Mental Health. I've been in the field of addiction for 15 years now. I was talking to Christina about how long I've been in the field, and I've been with Tri-City a year now, so it's not 14, it's 15. And I'm here to talk about vaping and e-cigarettes. So I'm just going to go ahead and start my slides. This is new for me. I think I'm going to scroll. There we go. What are e-cigarettes? E-cigarettes are known by many different names. There's e-cigs, there's e-hookahs, mods, vape pens, vapes and tank systems. Electronic nicotine delivery systems is like the most fanciest one that I think I've seen. Some e-cigarettes are made to look a lot like regular cigarettes, cigars, or pipes. And some resemble pens, USB sticks, and other everyday items. I'm going to use a commercial. I'm sure everybody has seen this commercial where there's 2 teenage girls and they're chit-chatting in their bedroom. It looks like they're kind of having a sleepover. And one of the young ladies takes a USB stick out of her computer, or that's what it looked like to me. And she handed it to this young lady, the other young lady. And it was so, what's the word I'm looking for? Covert. It was so inconspicuous. And it shocked me that it was actually a vape or a vape pen, and it looked exactly like a USB. And she took it out of her computer. Now that I'm remembering, she took it out of her computer. So I don't know if they have, well, you have to charge it one way or another. So I guess she was charging it in her computer. But they had to, they slow it down, and they show you exactly what it is. And it fooled me. It fooled me, and I'm like, oh my gosh, So yeah, they're made to look like USB sticks and all kinds of fun little gadgets. They come in fun little shapes, and some are real discreet and flat and can fit right in your pocket, and others are like big tanks, and those are called mods. And you'll see, those are obvious. You'll see somebody token on one of those. But anyway, going back to what e-cigarettes and vapes are, what they do is they produce an aerosol by heating a liquid that usually contains nicotine, which is the addictive drug in regular cigarettes and cigars and tobacco products. But there's also flavoring, and there's other chemicals to make the aerosol. Users inhale this aerosol into their lungs. And the thing is, bystanders can also breathe in this aerosol when the user exhales into the air. We've probably all seen those huge puffs of vape smoke that come out of a person who's vaping. And the tricky part of that is because of the flavorings, this vape smoke, this secondhand vape smoke, I guess we could call it, it smells so good. People, you know, people don't seem to mind it because it smells good. It doesn't stink like cigarettes do. So, you know, it's made to look real harmless for those around it and to the person who's vaping. So e-cigarettes can also be used to deliver marijuana and other drugs. So it gets even trickier. Let's see. Are e-cigarettes less harmful than regular cigarettes? E-cigarette aerosol generally contains fewer toxic chemicals than the deadly mix of 7,000 chemicals in smoke from regular cigarettes. However, e-cigarette aerosol is not harmless. It can contain harmful and potentially harmful substances, including nicotine, heavy metals like lead, volatile organic compounds, and cancer-causing agents. So rumor has it that vaping is safer because the only agents that are being inhaled are water and vapor and flavoring, and of course the nicotine, but this isn't the case. There are other chemicals that are being inhaled. Again, these chemicals can not only cause cancer, but they can also damage the reproductive system in women. These chemicals can also affect the brain's ability to function. For example, one of these chemicals it's called toluene. Toluene. It's kind of it's spelled Toluene, and it's pronounced toluene. This chemical can cause headaches and mental impairment. And this particular chemical can also be found in nail polish, glue, and paint fumes. Further, heavy metals like nickel, tin, and lead can also be found in the e-cigarette aerosol. All right, how many youth are vaping is the question. E-cigarettes and vaping have been the most commonly used tobacco product among US youth since 2014, very popular. In 2020, CDC and FDA data showed that at least 3.6 million US youth, including about 1 in 5 high school students and about 1 in 20 middle school students, used e-cigarettes in the past 30 days. Lung damage. Of course, there's lung damage associated with vaping. And of course, you'll get some symptoms like coughing, shortness of breath, chest pain, nausea, vomiting, stomach pain, diarrhea, fatigue, and there's unexpected weight loss. You know what? In addition to all of this, COVID-19, vaping can affect a person's ability to recover from COVID-19. The already present dangers of vaping are there. Growing evidence suggests that the aerosol in vaping can harm the lungs at the cellular and organic levels. And this worsens the body's ability to fight respiratory infections. And we all know that, you know, COVID-19 is a respiratory infection. So that is another danger. And I just wanted to go over a couple of other health concerns when it comes to vaping. E-cigarettes and vaping, they can lead to hospitalization. And, oh wait, I'm gonna go back here. So they can lead to hospitalizations and death. In 2019, there was a sudden influx of severe lung illnesses from vaping, and this affected over 1,000 people in the United States. And it became a health crisis, a public health crisis. I think it was like headlining in the news there for a little bit last year, and they were showing people in the ICU. So this affected over 1,000 people, and it became a public health crisis. And all of these people were hospitalized and needed various medical treatments, such as being placed on medically induced comas, breathing machines, and other life support measures. 2,801 cases of vaping lung illnesses have been reported so far across 50 states, Washington, D.C., and 2 U.S. territories. More than 200 of these cases are here in California. There have been 68 vaping deaths confirmed nationwide, with 5 of them being here in California. Products containing THC, especially those off of the street from family members or illegal dealers, are linked to most of these cases, and they have played a major role in the outbreak. However, the liquid in vape devices associated with lung illnesses include nicotine, THC, and or CBD. Many people say they vape nicotine and cannabis. I'm sure everybody here knows nicotine is a stimulant. THC is the main psychoactive compound found in cannabis, for example, marijuana. And it's the compound that produces the high sensation. And CBD is an oil found in cannabis. And there's no high sensation to it, but it's known to reduce anxiety and help manage pain. So it's legal and it's sold over the counter. And of course, marijuana is too. But so that's just kind of a breakdown of what CBD is, in case there are some people that don't know. So those are the latest statistics, if you will, when it comes to vaping. A lot more research still has to be done. And you know, they're working on it, and they're creating laws when it comes to vaping. They're working on all of that. So and if you would like to quit, we urge everyone to quit vaping altogether. I know a lot of people, like I said earlier, a lot of people vape to get off of cigarettes. And for some it works, but a lot of people, like I say, vape and smoke. So no matter what the substance, we urge people to quit. You can call 1-844-8-NO-VAPE, or go to nobuds.org for more information and support in order to stop vaping. So that's my spiel. We also have Heather, who is here to talk about how to quit.
Okay, thank you so much, Martina. I had no idea how prevalent the lung disease and the deaths were associated with vaping recently. That was really important information. Is there a way that I could have access to share my screen? I have some slides.
Well, I was made the co-host, so if you tell me when to go to the next slide, I'll be happy to go to the next slide.
I just made Heather co-host. I'm
Okay,
sorry.
cool.
Oh, okay, there we are. Can you guys see it?
Yes, we can.
How to quit. Okay. So now that we received all that really important information from Martina, if anyone is thinking of quitting, there is a way to do it. In 2018, a study was done with adult smokers that found over half tried to quit smoking in that past year. And that's about 21.5 million people that wanted to quit but failed. The study's kind of like a snapshot for us of how many want to quit, but find that it's hard to break free. I think we could see from some of the data that I have here on that slide that more than half of both groups of youth smokers and adult smokers have made an attempt to quit and have been unsuccessful. So it appears that the standard approach still to quitting smoking is to just go cold turkey, to try to white knuckle it and do it on your own. They found in that same study that over half of smokers didn't receive any advice from their doctors on how to quit, and a very small fraction received counseling or medication to quit. In fact, like only 6.8% receive any type of counseling to quit smoking. And what that leads to is less than 1 in 10 adults succeed in quitting per year. So we'll take it to the next slide because that seems pretty hopeless, but I want to just encourage you that there still is hope, because for those smokers that are able to quit, it is possible. Many are able to quit, and there are a ton of health benefits. It doesn't matter how long you have been smoking. It doesn't matter when you started smoking. If you quit, you are able to experience immediate benefits and improved health. Like within 2 to 3 months after quitting, your lung function is going to improve. 20 minutes after quitting, 20 minutes after quitting smoking, your heart rate's going to drop down. This is all physiological, scientific fact. And within 2 weeks to 3 months, your risk for a heart attack drops tremendously. So we know that there's benefits to quitting, and we know that it's possible. 3 out of 5 adults who have ever smoked have successfully quit over their lifetime. So there is hope. That comes to like 55 million people. The data in the study is in the small print just below on the slide. And you can find this at the CDC.gov website to verify these facts. So there is hope. It is possible to quit. But if you are considering quitting and you're not wanting to go through it the old-fashioned way of quitting cold turkey and white knuckling it, there are so many more support systems and tools available today than ever before. I would recommend, for me, finding out what is your why. Take some time to weigh out some of the costs if you continue to smoke. What got you started in smoking, because there might be some benefits that you can replace with some healthier things. And just really finding out what your why is on why you want to quit smoking, because that could be a really good motivating factor to keep you going through the process. And it could also be a really good plan to get started, to set a date. So once you have figured out your why, you want to develop a plan, and you can set a date. You can include a family member or a loved one. You want to get mentally and physically ready because there's going to be stress that's going to come in life. You're going to have to continue to work. You're going to have to continue to do life every day. And as that comes up, you're going to want to have some support. So here's some of the support that is available to us. There's free coaching, smoking cessation that's offered just by calling a toll-free number, 1-800-QUIT-NOW. They actually have even more support systems listed on cdc.gov/quit. They've got a plethora of tools and apps. They've got the coaching hotline. They've got a text-based app so that you can continue to get encouragement and tips and strategies. If you don't want to white knuckle it and you are struggling with cravings and that has done you in before, you can talk to your doctor about nicotine replacements. There's some that are over the counter. There's some that can be prescribed. Another thing that works really well as a strategy is to begin to track the benefits right away, the health benefits. You're going to notice that you can breathe clearly. You're going to notice that you can taste your food, that you can smell. And so weaving in mindfulness, weaving in walking, exercise, eating healthy can be another resiliency factor that can just keep you motivated and keep you going on that plan. So you create like a snowball effect. One way, one approach is creating a smoking cessation contract that you set the day, you write down the reasons why you want to quit, you make a commitment, you sign it, and you share it with a buddy that's going to hold you accountable and that's going to encourage you. I know for me, I found that you want to make sure, I found what's helpful is to make sure the buddy is supportive, that the buddy is positive and is going to continue to encourage, but not shame or criticize you when there's slip ups. So if you ever experience a slip up, stay on track, keep going, have your reasons why, pull them out, remind yourself of them and keep going. A slip up does not have to be the end. What I have found is trying to quit smoking is not something that we do when we're inundated with facts and when we're scared by all of the images and all the statistics and the data of what this does to your lungs, what this does to your body and to your organs. What I have found is what helps a person quit smoking is to find their why. Find what is uncomfortable for you and what it means for you to finally be free, and then build on that with your support system and to use every tool that's available now. There's no shame in using every tool. And that is all I have for today.
That was a wonderful presentation. Thank you, Martina. Thank you so much, Heather. I appreciate both of you. We all appreciate you. Does anyone have any questions regarding either of these presentations? Please feel free to ask whatever you might want to know on the topics that were covered. Anyone? I just wanted to say that I know one of the things that Martina had touched on with respect to vaping in hospitals was the e-cigarette vaping product use associated lung injury, or EVALI. Yes, that was absolutely an epidemic and not good. And we know that it's still going on. We can't assume that there are not still a high amount of hospitalizations or injury being reported, just that COVID is going on. And so I'm sure whatever is happening is probably being overlooked, as many things are. So, yeah.
Probably.
I imagine, I mean, I know it's really difficult to go to a hospital now. And God forbid you have something going on, with your lungs. They are
right.
very reluctant to have you there because they don't know what's going on. So this is a very interesting time for all of this to be going on. Does anyone have any statements or thoughts they'd like to contribute? Andrea?
Yes. I think I just want to highlight the importance of having like a really good support system when you're trying to quit smoking, especially if you live in a household with other smokers and you're trying to quit. So for example, I have an aunt who actually started smoking really, really late in life. I think she started in her 40s and she's now in her 80s, and her doctor was like, yeah, you need to quit. Like, your kidneys are failing. Girl, just stop. Right? So she did stop for a while. She stopped for over a year, but unfortunately, she lives in a house with a lot of smokers. And I think that that has now caused her to relapse. Now she's back to smoking. So I think it's just important to be in an environment that's sort of conducive to quitting, or at least expressing to the people who you're around, the people who you live with, the importance of sort of keeping that away from you if you're trying to quit. Yeah,
I'm so glad that you mentioned that, Andrea, and I forgot to mention that. That's something I wanted to include towards the end. Is in part of the plan, you've got to know your weak spots and know your hot spots. I call them hot spots, those moments where you're always going to crave. And a lot of people don't realize when they're going in for the first time and creating a plan that we've weaved smoking into our lifestyle. There are certain activities every day we have associated with lighting a cigarette, like our coffee first thing in the morning. Like when we get in the car, we roll down the window and we're taking a drive, we're going to reach for a cigarette. So there's a lot of things that you can avoid in day-to-day life that are automatically in your mind connected with smoking. You will want to be prepared to have a stick of gum, to have some hard candy, to have something with you to not reach for the automatic response of lighting up a cigarette, but also the friends that were around and the family members if we're smoking. And one thing I wanted to mention, so Andrea, I'm so glad that you brought this up and we have the time. For those that are in households with other members that are smoking, if it's a spouse, a significant other, you can still quit. It will take a lot of work, but you can ask that loved one to try to start smoking outside for you because you've created a contract and that you really want to do this, and try to get that support. If they're not willing or able to do that because they're not in the same place as you are in your recovery journey, then go ahead and plan that there will be certain moments immediately after your meal, especially dinner time. You will want to plan to go outside and take a walk and get some fresh air. You will want to remove yourself and be away from people. If there's certain meetings that you go to where afterwards or during break time, many people smoke, you will know that you'll have a different route that you're going to take so that you're not around it until you get stronger. For me personally, I am an ex-smoker, and I can say with hope, it can get better where when you're around it, you're strong enough to say, I'm not going back to that. It's not worth it. And it doesn't have the strong pull as it does in the beginning. So there is hope. Hang in there. It's so worth it.
That was so encouraging, Heather. Thank you so much for, continuing to encourage those who are working to break away from the challenge that they're having with smoking. I think that it is so significant what everyone is doing, what everyone is sharing, because again, this is not a time where a lot of people have the support that they need to, further learn about resources or to learn about, anything with respect to smoking, secondhand smoke, lung injury, or anything of that nature. I think that, a lot of times we are very much so, even those of us who are doing this professionally, we get caught up in, meeting the goals and the objectives, and we kind of tend to, I don't want to say forget about the humanistic aspect of it, but we kind of, put those goals at the forefront of our mind, and we're panicked because we're like, okay, we're in a pandemic, we have work to do, and we still have to get things done. But I think today is a really good day for us to step back from that and think about the people who are really, suffering and struggling with tobacco addiction and other addictions. So thank you all for being here. So
thank you very much.
Yes, my pleasure, my pleasure. I still want to keep the door open for anyone to ask any questions or to make any inquiries about anything specific. No? No one? Okay, so I don't feel like it's always necessary to reinvent the whole wheel. And earlier, well, I don't think anyone was on here earlier except for Jessica. I did see Jessica earlier when we did this. We're going to play a quick game called Tobacco Trivia. So let me. Okay, so there should be a poll that just popped up for everyone. And we're going to go through this together because I'm just really curious as to what you all are thinking. And well, it's all for fun and it's a good learning game as well, but how did soldiers get hooked on cigarettes during the First and Second World Wars? Did they A, begin smoking before they joined the military, B, found them and thought to try them, as if they didn't have enough going on, right? Or C, tobacco companies put free cigarettes in their MREs, or meals ready to eat, which also contain necessities such as vitamins and hygiene products. What do you all think? And you can unmute yourself. Oh, we got a C.
I'm going to go with C.
Those darn tobacco companies.
Yeah.
Everybody's going to go with C, huh? That's it.
And I believe they were Lucky Strike.
You are right. Yes, they were Lucky Strike, unfortunately.
Yeah.
I don't think anybody just picks up, like Larry described, picks up a roll of leaves and decides, let's burn them and inhale them and see what would happen.
Well, and if we do, then we must be some pretty strange creatures, right? Okay, so the next question. Which famous tobacco product was created and marketed to women specifically? Was it A, Newports, B, Camel, or C, Virginia Slims?
Virginia Slims.
C.
Everybody is going to go with Virginia Slims, huh?
Because it was going to make them slim.
Oh, okay, so yes, that is how they marketed it. Tobacco companies are very strategic, as we know. They said, okay, look, women don't know nothing. That's really how they said it, okay? Women don't know nothing in these times. And if we tell them that they will look beautiful and be more pretty while smoking, they will believe it. And they will also be slim. And of course, they didn't discuss why that might be. But of course, you know, the way they went ahead and showed it or explained it, it was appealing, right? So there we go. We have all the moms of the 60s and the 50s with Virginia Slim in their hands. So there we go. Let's see. Number 3, which cigarette brand markets itself as refreshing? Wait, let's stop there. Can a cigarette be refreshing as bad as it smells? And I know, I mean, I don't know how the experience is for everyone, whether you're a smoker or a non-smoker. When you first smell it, does it smell nice to you? Does it smell like refreshment? That's what.
It's the taste. And with menthol, you can definitely sense that taste. A new thing, so to not take away from the number 3 question, but another trick that recently was used was Camel brought out a cigarette that was just normal, but it had a little tiny capsule in the filter, and you could squeeze it and pop it, and then you could choose if you wanted to switch it to that menthol flavor. And it does feel like menthol. It does feel cool when you're inhaling, but afterwards, whole different story.
Well, so let's touch on all the senses then. You see it. It doesn't look refreshing. You smell it. I don't think it smells refreshing. I'm not sure, but I don't think so. So in my mind, you have to, like, we think with our senses, right? We operate with our senses. So what happens between the point of seeing it and smelling it? And it doesn't look great. It doesn't smell great. So we actually taste it now. What's happened between the last point and this one?
Another draw to smoking that many will say who are trying to quit is it relaxes me. It relaxes me. And we know that it actually increases depression and anxiety, that it's a trick. But in that moment, what I've discovered is it's that one time that a person who's very, very busy gives themselves permission to go take a break, to sit down and disconnect from all the stressors and to breathe. And then you notice the practicing of the inhaling is slow because it is deep, because you're trying to get as much nicotine as you can. And over time, you know, when you get past the gag reflex, you're actually inhaling deeply and slowly. And so it's the whole ritual, the same as other addictive substances, where you begin to get your gear out, your lighter, your vape, you begin to prepare mentally and just like emotionally that you're going to have some downtime. And next thing you know, you're hooked because you have a physical tolerance to the nicotine. That's the sensation. And when I figured that out, that was a big catalyst for me to be able to recognize what is the positive gain and then start replacing it with something healthier.
That is so awesome. That was like very well broken down, and it was very visual for me because I imagine people doing things. So I did imagine you, not you literally, but anyone sitting down, they're starting to take their things out. They're getting the little vape canister, and it's the process. It's the process.
It's the process. And you're going to do it socially too. You're going to, because nobody says one day, I want to wake up and go get addicted to cigarettes. So let me go run to the store and try this. Because your initial reflex is going to be a gag reflex because your lungs tell you this is foreign, this is not good. So it's a social endeavor too. You're going to be doing it with friends that go, but this is what we do. And we slow down and we visit and we talk. A lot of models use it. A lot of models use it in their breaks so that they curb their appetite and they socialize.
That is so interesting.
Awful things to your body. Awful.
Virginia Slims, shame on them. And cool, oh, well, whoever this is, Cools.
Yeah.
I just gave away the answer. I wasn't supposed to do that. That's why I said whoever this is, but it's too late. I let it slip. Well, okay, bye Santa Fe, bye Paul Malls. We know it wasn't y'all. We'll keep on moving. True or false, vape pens and juices are marketed specifically to the youth?
True.
So we saw in an earlier presentation with Jessica that they make all of these really pretty looking boxes and they're imitating cereals and candies, and they're colorful and all of the things that are exciting to young people. And some of the older generations, I mean, who have nothing else to do, they think. So and the people that I'm really referring to, because I'm hearing that this is something that is happening now, are millennials. Millennials apparently like pretty boxes, and we are older than very young people. So we like colors and cereals as well. And, you know, I am absolutely a proponent of sitting down and having a box of, well, a box sitting in front of me of Lucky Charms. I don't always eat it, but it looks good, right? So there they go.
All you millennials.
I know, shame on us. So let's see. What product is commonly used by teens and young adults? Is it chewing tobacco, vapes and e-cigarettes, or cigarettes? Now, this could be a trick question. Don't think you know the answer to this. You don't know.
Well, now you have me doubting.
Yeah.
I'm going to say, I would think vape because it's so cool and it's easily hidden. The odor doesn't give them away. So I'm going to go with e-cigarettes.
I would think that first too.
Okay, so we have two age groups in here. We have teens and young adults. And so it really kind of depends on where they are located, because if you are out there in the Midwest and you are in a very rural town, you don't really have access to vapes like that. But yes, if you're down here in California, you are all for the vaping, right, as a young person. So that was a trick question, and it's really kind of geographically impacted. At this point, I don't suspect that it will be that way forever, because things are spreading out. But I was just reading a few different things, and these are not my questions, by the way. These are Atticus questions, but I thought they were good questions, and since no one got to participate, I thought I would re-ask them or reintroduce them. So something I did see, though, was for like people in the Deep South, maybe they are more apt to have a cigarette because that's what's in their space, or they're more apt to have chewing tobacco because that's what's in their space, and not so much a vape. They are like, what is that?
Okay.
So, yeah.
All right.
But if you just want to talk about California, yes, it's the vapes and the e-cigarettes. New York, I'm sure it's vapes and e-cigarettes, and all of the very populous areas that have access to, you know, a lot of media outlets and whatnot. So, true or false, Big Tobacco went into neighborhoods of people of color and low income to hand out free cigarettes?
I'm sure that's true.
I kind of want to say true.
True.
I say true.
Dr. Larry?
Legal tobacco.
Oh, absolutely. In fact, when I went to college, it wasn't the low income. They were handing out free cigarettes at college too.
Oh my gosh.
When we were registering.
Oh my goodness.
Now I'm 72 years old, so I'm on the other side of the spectrum. But yeah, they were handing out cigarettes.
That's crazy. Juan, hi.
I just wanted to share, that's actually insane. That's the first time I hear of that, handing out like tobacco to like people in communities of color and like low income. That's insane. I've never heard of that. And it's funny that you mentioned that they were handing them out in registration. I was going to say nowadays they're handing out like Red Bulls and stuff. It's like always something else to get the millennials hooked on something, right?
Yes. So true.
I just want to add that I've also heard that there's been accounts where there's like coupons that would literally be mailed to your house, and they were primarily in low-income, minority, and neighborhoods of color as well.
This is so shameful just to see the targeting. So it's always going to be young people. It's always going to be people of, and this is all separate of each other. Sometimes it's grouped together, but we see this frequently happening. Young people, they don't care. If you're young, that's great. We know that we can get you hooked. You're a lifelong purchaser at this point, or investor. So people of color, they know that, you know, there's a lot of trauma and a lot of other things that are experienced in neighborhoods where there are, you know, people, again, of color. So it's really unfortunate, but this is the way that Big Tobacco has targeted us. And it's kind of changed, it's evolved over the course of time, because I want to say in the 1700s, they had people of color that were doing, they were farming the tobacco. They were responsible for farming the tobacco. And then when they were making the cigarettes that they were making, or the tobacco products they were making, it was really only for people who could afford it, which at that time would have been people who were in, well, various, not populations, but various careers, but they were Caucasian people at that time, right? But that changed, because what happens when you become more educated, more aware, if you're not already hooked, you know, the usage decreases. So then it's like, okay, on to the next target. So women were the next target after that. Didn't matter what color, just wanted to know that you were a woman, and if we could target you, great. And then we move on, and that's when you really hit the minority populations, and we have not left that point. We just kind of added young people to it. So very interesting where we are, and you know, how things have gone, and it's unfortunate. And the next question. So there's actually not a right answer in this question, because one of those should have said billions and not trillions. But every year, the tobacco industry does invest a great amount of money into their marketing. I just gave you the answer. But if you didn't know the answer, out of trillions, thousands, and millions, what would you have thought?
I would have thought it would have hit trillions. And if you're talking worldwide, if you go to Italy, people smoke. Oh my God, you know, and a lot of European countries.
I think at that point it is trillions for sure.
Yeah.
Yeah. Yeah, for sure. That's expansive thinking though. You know, my brain wasn't going that far.
It's because I want to go there and I can't.
You're going, you're still
Sooner or
going.
later.
Yes, you're going. It'll take a little time, but you'll get there. Let's see. True or false? Animals are affected by secondhand smoke.
Yes.
So I kind of went over that earlier. I had a little presentation. I don't want to bore anyone with it again, but it was just, you know, sharing that animals also get cancer and that, you know, we have to be considerate of that because they are grooming themselves. And when they're doing that, they're licking the byproduct of whatever it was they were exposed to up, and it's being ingested into their systems, and they're developing tumors and all sorts of things. So, you know, the animals are suffering, pets are suffering. And for people who don't really care about people, they usually care about animals. You can let them know that if they have pets, you know, that is a great consideration to have. Let's see. How does the tobacco industry market, and I knew we had this question, but we kind of went over it already, market their products, especially vapes, commercials, coupons with in-store and online promotion, social media, or all of the above?
All of the above.
All of the above. They're so
They're gonna
sneaky.
leave, yeah, they're going to leave no stone unturned to get new people addicted to their product.
Yes. And if you look back at some of there are documents in UCSF, and you can go back and look at documents from the 50s and 60s, and they're just, gosh, they have these diabolical plans to make sure that everyone gets hooked. And it's like, yes, we know what it's going to do to them, but they don't know what it's going to do to them. So it doesn't really matter. Just keep pushing it. And it's crazy to think that there's a $1 trillion industry essentially that has this knowledge, but still is willing to kill the you know, the population who ends up addicted to these products, and the population that's not addicted to these products as well. And last question. You don't have to answer this if you don't want to, but true or false, smoking can cause erectile dysfunction, worsening eyesight, and decreased taste?
Say true.
Yeah.
I didn't know about the eyesight part though. I did not know that.
Yes, it does mess with, I mean, because, you know, your body doesn't regenerate the same types of healthy cells when you are poisoning it. So, and you know, your body, it's frequently and constantly regenerating its cells to keep up with things, but it can't do that if your immune system is not working. So it can mess with really anything, which is of course how cancer comes about. You'd be surprised at the strange things. I mean, you know about the taste buds, of course, and you know, you think about the smaller things, or you think about the really, really grand things, but rarely do we think about the things in between. Well, let's see who we have next. Okay, well, we actually have a break, and then we will have NCADD's multi-unit housing presentation, and I'm so excited to listen to that and see that. We didn't want to keep anyone stuck in this room all day, so you know, we broke it up. We encourage you to go and take a walk, go sip some tea, or as Mr. Newman was drinking earlier, tea with, what did he say? Tea with milk. Enjoy it.
All right. Thank you so much.
Thank you, Martina. Thank you so much, Heather.
Thanks for having us.
Please feel free to come back. Again, we'll be here until like 5:30, after 4 or at 4, from 4 to 5:30. But I want everyone to get up and stretch and, you know, and I will be
I
here.
have to bow out for another meeting, but good seeing you, Shane.
Thank you. Good to see you, Larry. Thank you so much for coming by. Again, everyone, this is Mayor Schrader, and he is such an awesome person. So I appreciate him taking his time out to come and visit with us today.
Awesome.
You take
Thanks,
care.
everybody.
You too. Thank you. Bye. I'll be here. I'm not leaving. So I have to let people back into the room.
Oh.
So I can't really go anywhere, which is okay with me. Gloria, are you still here?
I am. Hi.
How are you doing?
I'm doing good. Just busy. Sorry, I like keep coming in and out because I'm trying to fit this within everything else that's happening. But I'm here.
No. I completely understand. And just you showing up is really appreciated. It's been a long day, but we've had a lot of really good presentations. So I'm glad that we had this opportunity. And goodness, what can I say? I'm going to pause the recording, and all of you who are watching via the recording will be back soon.
Or we have NCADD multi-unit housing presenting on the dangers of secondhand smoke in multi-unit housing. So we have Andrea and Angelica presenting.
Yes, hi everyone. I'm gonna go ahead and share my screen. Oh, looks like I can't share yet. If you could give me access, Erica, that would be great.
Oh, I'm sorry. Wait, I can't. Oh, there.
Yeah, it looks like it's working now. Thank you. Okay, so everybody could see my screen. Just have to ask. Okay, so hi everybody, my name is Angelica Hernandez. I am one of the community engagement coordinators here at NCADD. That's the National Council on Alcoholism and Drug Dependence. Did you want to introduce yourself, Andrea?
Yes, my name is Andrea Smith and I'm the project coordinator over at NCADD.
Okay, so today we're going to be talking about secondhand smoke and vape in multi-unit housing. So like I just mentioned, we are NCADD, the National Council on Alcoholism and Drug Dependence. We focus on East San Gabriel and Pomona valleys. We provide prevention, treatment, education, and referral services in regards to alcoholism and other drug addictions and related issues. So today we're going to be talking about secondhand smoke, why secondhand smoke is an issue in multi-unit housing, particularly for vulnerable populations like children, seniors, and families. We're also going to be talking about vaping in multi-unit housing, third-hand smoke and why it's harmful, smoking and COVID-19. And then we're going to be talking about smoke-free multi-unit housing policies and what that kind of looks like. And then a little bit about our coalitions, and then a chance for Q&As at the end.
Okay, so secondhand smoke is smoke from the lit end of a tobacco or marijuana burning product. It's smoke that has been exhaled by the smoker. It contains over 7,000 toxic chemicals. Some of those chemicals are cyanide, which can be found in chemical weapons, butane, which can be found in lighter fluid, as well as ammonia, which can be found in some household cleaners. The Surgeon General has stated that there is no risk-free level of exposure to secondhand smoke. So even if you are around it for a short period of time, it's not safe to be around at all.
So we're here to talk about secondhand smoke in multi-unit housing. So just so you all know, multi-unit housing can be any type of housing that has 2 or more units. So that can be like apartments, condos, townhomes, and pretty much anything else that has 2 or more units. So secondhand smoke can drift inside these, types of housings through light fixtures, electrical outlets, even through walls, shared ventilation systems, and even from outdoor areas like balconies and patios, and also through doorways and windows.
So why is secondhand smoke a problem in multi-unit housing? Essentially for the reason that Angelica just stated, secondhand smoke drifts. In multi-unit housing, we find that it affects vulnerable populations the most, so children, seniors, those with disabilities as well. Some of the ways that it affects children are by way of ear infections, different respiratory problems like asthma, as well as a greater risk of sudden infant death syndrome. We find that in seniors, many diseases are more prevalent in this age group, and secondhand smoke can sort of make those issues worse. In adults, it causes issues such as heart disease, lung cancer, stroke, and also death. Any pets that are exposed to secondhand smoke are at a higher risk of developing cancer as well as other illnesses. Months after being exposed to secondhand smoke, cancer-causing chemicals are still found in the hair and urine of dogs. We also know that dogs do like to groom themselves, right? They like to, lift their fur. The chemical of secondhand smoke is still found on pets even after certain months. So it's important to speak for those who are not able to speak for themselves, particularly children living in multi-unit housing who are exposed to secondhand smoke. We do have some stats in terms of people who have died from secondhand smoke exposure per year. We find that 48,000 people have died per year, and then 400 infants per year. These are deaths, again, that are caused by secondhand smoke. So people who have likely never picked up a cigarette in their life.
We also wanted to talk about secondhand aerosol, which is pretty much secondhand smoke that comes from electronic smoking devices. So it's a really common misconception that electronic cigarettes are safer than traditional cigarettes. But if you have ever had hairspray on your hands, that's actually what an aerosol is. So you know that it's really sticky. So just thinking about what that does to your lungs over time is pretty scary to think about. So aerosol is inhaled and exhaled. And it also contains very ultrafine particles. So what that means is that they're very tiny. So it's easier for your lungs to ingest them way deeper. And then they can become trapped in your lungs, which over time that can lead to tissue inflammation, and that's very dangerous. Any exposure to secondhand smoke really, regardless of it being cigarette, vape, or marijuana, is really dangerous in multi-unit housing since it drifts, like Andrea said, even to people who are non-smokers.
So I'm going to be talking about vaping in multi-unit housing. E-cigarettes, we know, are popular among people seeking an alternative to traditional cigarettes. They think that it's a healthier option. It's an option that they use to quit smoking, essentially. We also find that there are youth who are using vaping products, especially because of the increase in flavored tobacco products over the last couple of years. E-cigarettes, specifically in multi-unit housing, can cause an increased risk of fire due to e-cigarette explosion. A couple of years ago, we saw an increase in that as well, like vaping products blowing up in people's faces. But also children can be exposed to vape juice and possibly ingest them, as well as pets. Also, it creates surfaces of toxic residue that's caused by the aerosol, which exposes bystanders to harmful substances.
So I'm sure we're all familiar with what secondhand smoke is, but we also wanted to talk about thirdhand smoke. So thirdhand smoke is actually the residue that's left behind. Here it says when someone smokes indoors, but it could even be smoking outdoors because it could land on your clothing. And really, it just gets more toxic over time. So it's really dangerous because it clings to clothing, carpet, furniture, it clings to the hair and the skin. This is particularly dangerous for children, and especially babies who are crawling around, because if they put everything, you know, they always put their hands in their mouths. So thinking about that is very scary.
We also wanted to show you guys what third-hand smoke actually looks like. It's one thing, I think, for us to talk about it, but I think some of us, if not most of us, are visual learners. So I just kind of want you to see what third-hand smoke actually looks like. You can see that the white parts of the wall there are where pictures were. And so that's the original color of the walls. Whereas everything that's left around it is basically the residue that's associated with third-hand smoke. Even in the middle picture, you can see there, I think that looks like a closet, like the top part of a closet. That substance there, that sort of browny, nasty substance there is not brass. It's actually residue from third-hand smoke. And you can see that once it's removed, you're able to see the actual color of that part of the wall there.
So we also wanted to talk about smoking and COVID-19, especially because the stay-at-home order increases exposure to secondhand smoke and third-hand smoke, especially since families are spending more time at home. A lot of us are working from home. There's not much to do. So, you know, a lot of us are home more of the time now in order to decrease the spread of coronavirus. And as a result, a lot more people are being exposed to secondhand smoke and third-hand smoke in their homes. Secondhand smoke definitely weakens the immune system, which can make it really hard to fight infections. And it also makes infections that you do get a little bit more severe. So aerosol from vaping devices is very harmful to the lungs. And it definitely affects the body's ability to fight these infections. Since coronavirus is a respiratory infection that specifically affects the lungs, that's something that we find particularly, you know, interesting and problematic, and we have to keep an eye on that.
Okay, so I'm going to be talking about smoke-free multi-unit housing, which is a law that limits or prohibits smoking in and or around multi-unit housing, including the establishment of non-smoking units and non-smoking common areas. I think maybe 1 in 4 residents across the United States live in multi-unit housing. 1 in 3 are exposed, I believe. So the importance of the implementation of smoke-free multi-unit housing is just to keep communities safe.
So there could be a comprehensive multi-unit housing policy, and what that kind of looks like is that it prohibits smoking in 100% of individual units in these housing complexes, and it also includes balconies and patios. It also prohibits smoking in indoor common areas like hallways, laundry rooms, pool areas, patios, and play areas. And a comprehensive multi-unit housing policy also includes a definition of smoking that includes tobacco, cannabis, and electronic smoking devices.
And smoke-free multi-unit housing is important, again, just because it provides protection for residents in different communities. We want to obviously respect the rights of everybody, but I think it's also important to note that everyone should have the right to breathe clean air. The rights of non-smokers should be protected, especially those living in multi-unit housing, particularly when we're talking about vulnerable populations, children, family, youth, those with disabilities. Smoke-free multi-unit housing is also of importance because we know that it lowers smoking rates among youth and young adults. It also minimizes fire risk in multi-unit housing, provides economic benefits to landlords. I think the misconception is that if landlords require smoke-free multi-unit housing, that they're not going to have tenants. But in actuality, it's the complete opposite. Tenants definitely want to be, tenants want to live in multi-unit housing that does implement smoke-free multi-unit housing policies in order to keep themselves safe as well as their families. And it improves overall quality of life as well.
Okay, so just a little quick recap and summary of what we've talked about today. Secondhand smoke definitely drifts, and there's no no safe level of exposure. So even if one tenant smokes, it really drifts throughout the complex, and everybody is essentially smoking in, breathing in that secondhand smoke and thirdhand smoke. So even if you're a non-smoker, secondhand smoke definitely kills thousands of non-smokers each year. So it's something that we should keep an eye on. Vaping is definitely not safe in multi-unit housing. We also talked about thirdhand smoke and how it's just as toxic, if not more toxic than secondhand smoke. We talked a little bit about how smoking can worsen your ability to fight off infections like coronavirus. And then how smoke-free multi-unit housing policies protect vulnerable populations. And lastly, the fact that everyone should have the right to breathe clean air, since there is no constitutional right to smoke. And smoking is also not a privacy right, and it's not protected under US law.
We also have more information about our coalition in San Dimas. We're focused on providing the community with tips and tools to live long, happy lives, promoting health and wellness. We educate our residents and teach them how to be more civically engaged. And if you'd like to find out more information about our coalition, we have an Instagram page. It's under Stay Well San Dimas. We also have a Facebook page under the same name as well.
Okay. Let me see, should I stop sharing? Let's see. Oh, and here's our contact information in case anybody has any questions that they'd like to ask us. I'll leave that up for a bit.
I have a question.
We can also put it in the chat later on.
I think someone was asking a question.
I think Belinda's asking a question, but we can't hear you, Belinda.
Can you guys hear me now? Okay, perfect. I just want to say thank you. I love the fact that you guys are advocating for multi-unit housing as we're speaking. I live in a condo and I have my window open right now and I can totally smell smoke from my neighbor downstairs and it really sucks. So yeah, all for multi-unit housing, but I do have a question because this is something that we also talk about on our program with like marijuana smoke and things like that. So if landlords and multi-unit housing or, businesses and stuff ban smoking within houses. Have you all have done any research or has anyone found anything about where can these people go to smoke or what do these people do? Because I think learning today about everything that entails tobacco and the history of it, I feel like it's also a social justice issue because tobacco companies market people of color and things like that, and so we also know people of color already at a disadvantage when it comes to housing and it's hard to find housing, and so in instances like that, has there been any solutions or any cities that have solutions as to where these people who do smoke can go smoke or any support for, I know there's tons of support to help them quit smoking, but I think a lot of people here said, it doesn't just happen overnight. So I don't know if y'all understood my question. I know I was rambling a little bit.
Oh, no, yeah, it was a good question. I think in different cities, I think different jurisdictions have implemented various multi-unit housing ordinances with sort of different layers. So for example, there are some cities that will allow people to smoke on balconies or they have designated smoking areas. The problem with that is that they're likely just remaining stagnant. So there's still drifting smoke that's going to enter into someone's unit. So I think some of the sort of model policies that we like to look at are cities such as Pasadena that have implemented smoke-free multi-unit housing ordinances. And it's been sort of a complete ban, if you will. So there are no designated smoking areas in terms of multi-unit housing. Thus, smokers in the city have to smoke on the sidewalk, and they have to remain walking. They can't just stand on the sidewalk and smoke because, again, there's that sort of risk of having drifting smoke enter into someone's home or in their unit. So the idea is that they should continue to walk on the sidewalk so that, again, drifting smoke doesn't enter into someone's house or their apartment building. Angelica,
I see why that would be problematic for people who do smoke. But I think over time, you know, what we're really looking at is social norm change. Because I know back then people were allowed to smoke inside airplanes and restaurants and all these sorts of places. Even back then, people didn't have to wear seat belts. So I think it does kind of sound like a radical idea, but I think in order to protect the greater good, I think, you know, it's pretty beneficial to examine these sorts of policies.
Agreed. I think that also people sort of forget that smoke drifts. I think that that's a point that we sort of hammer home a lot. They think that they're at home, that they're by themselves, they're in their unit. Great, but unfortunately, it affects other people around them. And I think that that's not something that is thought of a lot. So.
Great. Any other questions or any comments or thoughts that y'all have around this issue?
Yes.
We'd love to hear them.
So you know that I have to ask, we are still here, Bye Bye Butts Day. How would you encourage someone who wants to stop smoking to go about it? I mean, not with respect to smoking cessation, because I know that that's not your area, but what would you tell them with, you know, regards to what you do know?
I think I would invite them out for coffee or something and really just try to figure out how this started. Oftentimes I feel like there's an underlying, I don't want to say problem, but reason why someone smokes. I think I was on a call earlier and the guy said that it's really easy to continue the cycle of generations of, you know, chain smoking. And I really liked what he said about breaking the link. I think it's important to do that. So I think it all just starts with a conversation, and awareness is the first step. So I think if someone can try to figure out why they smoke, maybe they can find ways to find another thing to do that's a little bit more healthy, or, you know, find another skill or hobby that fulfills that need.
I agree.
Well, thank you for being such wonderful presenters. Y'all are awesome. And next we actually have Erica Gonzalez, who I have the honor of introducing. So let me get to it. Erica is the Community Engagement Coordinator at NCADD for outdoor areas. She graduated from Cal Poly Pomona with her bachelor's in kinesiology with an emphasis in health promotion, which is what she's doing now. Her goal is to go back to school for her master's in public health, and she enjoys greatly working in the community to help others improve their health and well-being. Thank you so much, Erica. We're excited to hear your presentation.
Thank you for sticking around to hear the final presentation of the evening. Let me just pull it up real quick. All right, here we go. So like Shay mentioned, I am the Community Engagement Coordinator, and my area of focus is smoke-free outdoor areas, which is why I decided to focus on the impacts of tobacco on the environment. So, I mean, I won't go over who NCADD is because we've heard it plenty times, and then I work with Angelica and Andrea, so it's the same thing. We all do the same thing. And then let me get this. Oop. So I'm going to show this little, oh no, is it playing? So I wanted to throw that little 30-second clip in there because it's from Tobacco Free California. So whenever I see it on TV, I'm like, it's so impactful. It's so true. Those 30 seconds. So those little cigarette butts are definitely harming our environment. So the World Health Organization estimates that there will be more than 8 million tobacco-related deaths a year by 2030, amounting to 10% of annual deaths worldwide. So I'm gonna start with a little bit of history on tobacco growing and curing. In 2011, around 42 million hectares of land were devoted to tobacco growing, representing less than 1% of total arable land globally. However, in severe low and middle income countries, the percentage of arable land devoted to tobacco growing has recently increased. Deforestation for tobacco growing has many serious environmental consequences, including the loss of biodiversity, soil erosion and degradation, water pollution, increases in atmospheric carbon dioxide. And as a consequence of tobacco agriculture, there are short-term benefits for some farmers, but of course the long-term effects are way worse, which include social, economic, health, and environmental determinants for many others. And then something else that I thought was interesting was that people don't think about the farm workers, but farm workers, especially child laborers, minorities, and migrant workers, are at risk of nicotine toxicity, green tobacco illness, which is caused by handling tobacco leaves without protection during harvest and processing. And then manufacturing and distribution. In 1995, it is estimated that global tobacco manufacturing produced over 2 million tons of solid waste, 300,000 tons of non-recyclable nicotine-containing waste, and 200,000 tons of chemical waste. Other toxic byproducts of tobacco manufacturing or chemicals used in manufacturing include ammonia, hydrochloric acid, toluene, and ethyl ketone, many bad chemicals that we probably should not be around. And then product consumption. So most cigarettes are lit by using matches or gas-filled lighters. For example, if one wooden match is used to light 2 cigarettes, the 6 trillion cigarettes smoked globally each year will require the destruction of about 9 million trees to produce 3 trillion matches. There are also environmental impacts of manufacturing and disposing of the plastic, metal, butane used in making cigarette lighters. In the US, cigarettes have been responsible for 8 to 10% of all fires over the past 10 years, my bad. On average, 90,000 fires per year. They also remain the single most important cause of deaths related to fires. And then, of course, post-consumption waste, which is the biggest thing we see all around. Cigarette butts are the most commonly discarded piece of waste globally and are the most frequent item of litter picked up on beaches and water edges worldwide. So the non-biodegradable filter attached to most manufactured cigarettes is the main component of cigarette butt waste, and trillions of filtered tip butts are discarded annually. So it takes, cigarette butts are not biodegradable, but it takes around anywhere between 18 to 10 years for them to start decomposing. So hazardous substances have been identified in cigarette butts, including arsenic, lead, nicotine, and phenol. These substances are leached from discarded butts into aquatic environments and soil. And then, of course, we have electronic cigarettes, which are very popular now, and they contain batteries that require special disposal, as well as chemicals, packaging, and other non-biodegradable materials. And with 6 trillion cigarettes manufactured annually, around 30 billion packages, assuming 20 cigarettes per pack, are made for tobacco products. Assuming each empty pack weighs about 6 grams, this amounts to 1 million tons of packaging waste composed of paper, ink, cellophane, foil, and glue. And then, of course, we can't forget about carbon dioxide emissions. Tobacco smoking leads directly to the emissions of 2 million tons of carbon dioxide and about over 5 million tons of methane. Worldwide, approximately 13 hectares of forests are lost due to agriculture or natural causes each year. And of this, at least 200 hectares are for tobacco agriculture and curing. Deforestation is the second largest anthropogenic source of carbon dioxide to the atmosphere, approximately 20%, after fossil fuel combustion. One estimate of the impact of deforestation in tobacco agriculture and curing is that it causes almost 5% of global greenhouse gas production. So the Truth Initiative says that tobacco use is not only a health issue, it is also an environmental issue. Billions of cigarettes, about 267 billion in 2015, are smoked each year in the United States. They are the most littered item in the country. The waste from cigarettes each can leach toxic chemicals into the environment, leading to land, water, and air pollution. So cigarette butts, again, contain plastic fillers and other remnants of smoking cigarettes can pollute soil, beaches, waterways. Studies have also shown that cigarette waste is harmful to wildlife. A study of the effects of roadside waste on soil found that the patterns of hydrocarbon levels in the soil were similar to those of littered cigarette butts. This indicates that the chemicals in the soil had seeped out of the cigarette butts. Some hydrocarbons are carcinogenic. So growing concern over the impacts of tobacco waste on the environment, as well as a sustained cost of cleanup, have prompted states, municipalities, and institutions to enact a variety of policy actions. For example, 312 municipalities have prohibited smoking on their beaches, while 1,497 prohibited smoking in parks as of July 2017. And here is our contact information. If anyone's interested to hear more about our smoke-free outdoor area efforts. And that was it for me. If anyone has any questions. We have tobacco trivia coming up next.
That was great, Erica. Thank you so much for taking the time out to share. We can let Atticus know that they can come in actually a little bit early.
Lots of numbers out there. I'm sorry. It was very
No, that was really good. I think when people start to really see the impact that this is making, it'll make them think twice before they throw cartons and cigarette butts and all sorts of things out and litter.
But people just keep throwing them out like it's nothing.
I didn't really think about like the land that it requires to grow all of the tobacco plants and all of the trees that have to be cut down for the papers and the wrapping. I think hearing all of this kind of, well, I don't want to say it made me sad, but I didn't really think about it that way, because I think when I think about tobacco and the environment, it's more about like secondhand smoke. But I learned a lot. So thank you, Erica.
Oh, thank you. Thank you all for sticking around for the last presentation.
Yes, and then we'll have Atticus who will come and do tobacco trivia part 2, which will be fun. I just reached out, so hopefully they will be able to show up in a moment. And that will, for the most part, conclude our programs. I'm going to put the number for 1-800 no butts and no smoking and all of those numbers into the chat box so that people can access them if they'd like. I actually am going to upload a flyer that I have with those numbers on there in honor of this day, which I knew was coming.
Sorry, we didn't really open it up to everyone, but I had a thought that I wanted to share when we were talking about our multi-unit housing presentation, and Belinda asked, where are people supposed to smoke? my thought was like the sidewalk or, you know, a parking lot or something. But I know that that's kind of your guys' area, huh? So I was just like, wow, I wonder what tobacco control will look like in a few years or a few decades. I wonder, hopefully we'll be able to reduce the prevalence of people even smoking to begin with.
And it's interesting because, well,
Hello,
I don't
Attica.
live in multi-unit housing, but not my neighbor, but like the other neighbor, he smokes and he goes outside to smoke. And whenever I step outside, I can smell it. So it's crazy to think that like if the house is like pretty spaced out, the houses, imagine in multi-unit housing, like that's ridiculous. And that's outside too. Now
Right.
imagine.
Happens to me all the time. I live in an apartment complex and it's not great. Sometimes I wake up and I go into my bathroom and it smells like smoke, or just like walking around taking my dog out to the bathroom. So yeah, not ideal.
No. Well, we are glad to see you, Atticus. I'm going to make you a co-host.
Thank you. Happy to be here.
Erica is actually going to go ahead and bring your PowerPoint and such up.
Do you want me to pull it up now?
Yes, please.
Okay.
Perfect. Thank you. Wonderful, wonderful. All right. Thank you, everyone, for being here. It's been a great day of awesome information. And so we're now going to talk about a little bit more of things that people may not actually know and that don't really get discussed in regards to tobacco and the tobacco industry. So for example, it has quite a devastating environmental impact. For example, there are about 4.5 trillion cigarette butts, littered all across the globe, and it's counting. And that's not including actually vaping products like the cartridges or the body of the product itself. And it actually has quite a high cost. For example, in California, just cleanup alone, it can range from 3 million to 16 million every single year just to clean up cigarette debris. And then there's also a high healthcare cost as well. For example, it's about, I don't know the exact number, but I do know it's trillions of dollars every single year in regards to cleaning up, as well as a lot of people suffer a lot of chronic health conditions in regards to smoking and even secondhand smoke. And so, for example, people who are being treated for like heart disease, lung cancer, and et cetera. So that goes into the impact of the cost as well. What's interesting and upsetting to note is that the tobacco industry actually sponsors a lot of different events. For example, they used to, and some still do, sponsor LGBTQ plus events like Pride events, for example, or concerts. And a lot have actually donated to said organizations, as well as like the NAACP, Black colleges as well. They've accepted donations from the tobacco industry. And I find that very interesting because in earlier, when I talked about predatory marketing tactics, we all know about the amazing work that the NAACP does, but the Black community is heavily targeted by menthol products, such as like Newports, and it's become a staple in their community due to the marketing tactics that have been implemented. Making it seem like that's something they value and that's part of their culture and it's part of who they are. But that's not the case at all. And another something to note is that scientists have actually, as far back as the 1600s, have noted the harmful effects of smoking. And this is when they were smoking mostly like pipe tobacco, really, not cigarettes themselves, but findings have shown that even all the way back then is that they would see scorched lungs and also issues with the throat as well. And what they believed, they didn't know was quite cancer yet, but is something that was along the lines of cancer as well. And so now we're going to start talking about e-cigarettes and vapes. they have high concentrations of nicotine. For example, one Juul pod is about a pack of cigarettes, and it goes all the way up to even like a Soren pod. It has as much nicotine as 90 cigarettes. Some teens and young adults actually use maybe like 1 to 2 pods a day, and that's super detrimental to their health because their brains are still developing. And what happens is with nicotine, it affects the frontal lobe, which is a part that helps with decision making. And Big Tobacco has a bunch of money to do their own research, and that's how they know that. And they know that lifelong users start young, and that's why they push their products to make them as sleek and interesting as possible, as tasty as possible. And also what's important to note is that they're not regulated actually by the FDA, at least in the United States. So for example, with nicotine solution, it can say that it doesn't contain nicotine at all, but it can still contain traces amounts of nicotine, which I find to be very interesting. And then also something important to note is a part of their marketing strategy in terms of e-cigarettes, they market it as like safe to use and it's just water vapor. It can help you stop smoking, like all these other things, right? But actually what happens is that it's not a water vapor, it's actually an aerosol. And what that means, it's kind of like a hairspray where it stays on your skin, into the environment. But also with this particular product, it actually contains 70 of the same cancerous causing chemicals that are in cigarettes, as well as ultrafine particles, which basically means there's like these little metals like nickel and lead that get trapped inside the lungs, and they actually like cut up and damage the lungs, unfortunately. And that's really huge, like detriment and like severe health impact. And it's so normalized now in our culture. And that was part of their rebranding, because they noticed back in the day that people weren't really smoking anymore, like cigarettes. It started to be on the decline. And so they bought out the vaping companies. And so part of their normalization strategy is making these new sleek designs and making that marketing of like, oh no, we're fine. We're actually not that unhealthy. You know, it's totally okay to like smoke this wherever because it's just water vapor. And now you can't really go anywhere. At least to me, I see it and smell it all the time. And I know that it's something that teens try to hide, because every time we do presentations and talk to youth, they are like, oh yeah, the bathroom reeks of like this stinky sweet stuff, and people try to hide it. And I've seen kids walk around, like put it in their sleeve and they take a puff and then, you know, they're out the door. And it's something that hopefully with this knowledge we can spread around and make people more aware of what actually happens and what Big Tobacco's agenda really is. And hopefully we can keep the fight going against Big Tobacco. Does anyone have any questions or any discussion to open up to the floor before we jump into our poll, or we can do so after our poll?
Great job, Atticus.
Thank you.
So for the polling questions, do I stop sharing this? I'm so sorry. I wasn't here for the first round.
It's perfectly okay. Thank you, everyone. I appreciate it. Let's see. So for the poll questions, let me see here. So I have the previous ones. I'm trying to locate. Here we are. Thank you for your patience. Haven't used a poll before, so I appreciate it. So I'm going to launch the new poll and then see how we all did.
Oh, I'm not allowed to participate because I'm the host.
That's okay. I'm sure you know these in your sleep, Shay.
Oh, no. I appreciate that, but no. Next time.
And yeah, please everyone take your time. There's no rush. And if you have a question, I'm happy to help. It doesn't have to mean, you know, you have to get it all right now. Perfect. I'll give it another 20 to 30 seconds and then I'm going to close the poll. Perfect. Okay. All right, let's see if I can share the results. Perfect. All right, so whoever did the poll, great job. Got them all right. Congratulations. Hold on, where's the little clap? Yeah. Woohoo. Good job. All right. Perfect. And then I'm happy to open the floor for discussion. Is there anything anyone has any questions about or want to know more about?
So I do have one question,
Yes.
and all of the presenters have to answer this question. What would you say with the knowledge that you have to people who want to stop smoking? How would you encourage them?
That's an excellent question. And I'm glad you brought it up because we do need to talk about resources more and what's actually available at like low to no cost for people. I actually have my sister, I think she still uses a Juul. And so that's been an ongoing process for me. It definitely started because she was more stressed out, but I would say I always support her and that I'm there for her and try to encourage her. And she knows the impacts, but you know, unfortunately she's addicted at this point. But I've been informing her of like different resources that she can use that are out there for her. So hopefully someday she takes that leap. Like the California Smokers Helpline, for example, they're free. They even have a vape line now, like languages. It's awesome.
Right, completely agreed. Thank you so much for your vulnerability and willingness to share that with us.
Yeah, absolutely.
I said before I got off of here that I wanted to share this. It's important, like you said, for people to see the numbers, know the number. Oh, really? How disrespectful. Okay, here we go. So sorry. We have smokefree.gov. We have www.nobuts.org. We have 1-800-NO-BUTS. We have 844-8-NO-VAPE. We have, well, this is Claremont's email. If you wanted to reach out via email, smoke.free.claremont@gmail.com. And we are not affiliated with any of the above associations, so we are not being paid. We just want to offer you resources and let you know that there are people who are here who care. I'm gonna stop sharing this now. And yes, even the little cigarette in the corner wants everyone to call these numbers. I know you see them. Thank you.
Thank you, Devancia. Those are very kind words. And I'm really glad you really loved the presentations today and that, oh, it's so awesome. Thank you.
Yes, thank you, thank you. I know that, you know, this was supposed to keep running, but I think that we have all of the people we are going to have, and we'll be posting this. Please let me know, email me if you would like this recording. It's a little bit choppy, but it's still recorded. And I'll get it to you within the next week, not tomorrow, because tomorrow it probably will take forever to download. I don't know how long these things take, but Monday or Tuesday, I can send it back to you. So just let me know. My email will be in the chat. Thank you so much, Monica. Monica says it was really great to learn the different things that I did not consider in regards to smoking. All great presenters. Thank you. Well, thank you. If anyone else wants to put their email in the chat for anyone to ask questions, please feel free. If not, that's fine. My email is there. I am grateful again for everyone. I'm going to stop recording at this time. Thank you for being here. Thank you for your presentations. This is for also all of the people who presented earlier in the day. Thank you so much. All of your information is extremely impactful and highly appreciated. So take care, everyone. Thank you.